feeling for lumps.
Yes.
You're feeling for things that are hard, like nutmegs. But if you find something, first thing is you don't panic.
I had a kebab knife through that hand,
Yeah.
chopped my knuckle off.
Kebab knife, did you say?
Kebab knife's worse than a dog bite and a human bite.
Jeez.
I don't want to be, abnormal person. This is better if I go with my sickness and die one time.
So you've submitted a urine sample,
Yeah, urine sample, yeah.
but it was meant to be a poo sample.
Poo sample, what is...
So you need to poo. That's where all the problems started.
And you talked about feeling suicidal. What is it you thought about doing?
Just, like, chucking myself under a train.
Would you like to see a doctor?
Yeah, I phoned up and booked an appointment.
OK, what's your name?
Spiritual heart.
Surgery Stacey speaking. Sorry for the delay. How can I help?
Why do I have to do... Oh.
Because it goes out every 3 months.
Why doesn't it warn me that
It probably does, actually.
No, it doesn't.
Well, just put it in again.
OK, well, you have got a locum, but you're on the system. Yeah, you're on the system, and there's 1, 2, 3, 4, 5 patients waiting. Oh, bloody hell. All right, then. OK, bye. OK.
Next available.
Move these over to Ferdy.
Spencer?
Sorry.
That's all right.
I'm so glad to see you.
Why is that?
Bloody marvellous last night.
What was I? What happened to you?
Beat me up Monday or Sunday, broke my ribs, and one member of my family, I won't say his name, hit me because he thought he could do me with bad ribs, so he knew I was vulnerable. And the hospital gave me codeine last night, and because I'm on Subutex, I can't take codeine. I'm sorry, I can't breathe properly.
Yes.
I don't like to lie.
That's all right. I appreciate you not lying. You've been to A&E a lot recently, haven't you?
Yeah, I have.
Good morning, St John's Medical Centre. Sarah speaking. How can I help?
I think everyone's waiting like 45 minutes out there. I'm going to get lynched.
Good girl. Let me just move that chair and then you can reverse into this spot.
Right, push up with that hand. OK? Yeah. See if you can do that every time you get in and out of bed. Are you all right?
Low. Keep going, keep going, keep going. Push, 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 push. Go on, you can do it, you can do it, you can do it. You're gonna kill me, you. Oh, dear. That cleared your chest, didn't it? Right. When you do stand up and things, do you get short of breath with that?
Well, do you know what? If I was to tell you something, right, you wouldn't believe it. I'm no better off now for giving it up than I was when I was smoking. I've got more problems now. I've got high blood pressure.
Oh, have you?
Yeah, which I never had before.
Well, it's
My cholesterol always goes through the roof. Every time I give it up, I end up with more ailments than they do if I'm smoking.
But just think how better you'll feel in, like,
Well,
another
the money's
year's
a lot
time.
better.
Yeah, exactly. You got some more dosh in your pocket.
Yeah. I get out and about, because in the winter I don't go out as much as I do in the summer.
No. Mind you, if you had a better wheelchair, you might get out a bit more, mightn't you?
Yeah, well, sometimes if I had a better carer. He's nearly tipped me out the wheelchair on the way here. Him. And standing there laughing, pushing the trolley.
Now you're a young man.
No, it's very high, dude.
Get out of it, you're a bloke.
You know,
Oh, dear.
Shed nits. Yeah, you can go to the pharmacy and buy some stuff there to get rid of them. You wouldn't really need to see a doctor for that.
I've been getting breast pains since the car accident now.
Yes.
It's become more predominant with pain, more sensitivity, and it's more my right breast more than my left.
Right. I think we probably ought to examine your breasts today.
Yes, please.
Don't you think? You'd have been here quickly if you'd had any lumps, wouldn't you?
I would have been, or I would have gone to A&E if you wasn't here, so I would have definitely acted upon it straight away.
You would have gone to A&E?
If you wasn't here, yeah.
Don't go to A&E.
All right, fair enough.
How long have those doctors been qualified in A&E?
I don't know, not long probably.
Exactly. How long have I been qualified? Ages.
25 years as I've known you, and
Yeah.
I don't know what other on top of that you've had.
What I'm saying to you is, if you did feel a lump, phone the surgery and you book an appointment. You say, I want an appointment as soon as possible, and then they'll fit you in.
Okay.
As long as you're seen within 48 hours, if you've got a lump, that's fine.
Okay.
I just need to look in your eye.
Please don't at me.
Look straight ahead at me. Good. Lucky boy. The eye's going to be all right.
Oh, look. That's not my knockout punch. It's my left hand.
Yeah, well, you're holding that a bit carefully. Is that giving you a lot of pain?
My knuckle's back. I had a kebab knife through that hand.
Yeah.
Chopped my knuckle off.
Kebab knife, did you say?
Yeah, went through there.
Oh, yeah, I can see it.
An enemy, believe it or not, jumped over in a kebab shop, pulled a kebab knife out. I jumped over the kebab counter and tried to grab it off him. I didn't know that was double-bladed.
Yeah, they're sharp.
Kebab knife's worse than a dog bite and a human bite. I've got so many scars rolled out.
Yeah.
There. More.
Yeah.
More. But I'm a nice guy.
Right.
I'm sorry.
You can take things like ibuprofen, can't you?
I've got ibuprofen. They're bloody shit.
Yeah, this is stronger than ibuprofen, but it works in the same way. It should help to manage your pain a lot better.
Okay. When I saw your face, I was bloody happy.
Good. Well, I'm glad, Spencer. All right then, Spencer. Take care.
Right.
All the best.
Oh, well, thank you very much.
No problem. Bye-bye.
You're looking at the nipples. Which way are they pointing? Make sure they both go in the same direction.
Okay.
You're not one pointing upwards and one going downwards. Then you haven't got any nipples that are going inwards.
No.
And you haven't got any what we call dimpling on the skin, so that's a sort of bubble or dimple. Brilliant. OK, you've done very well. Now let's have you lying down. So once you've done that, then you proceed to the feel bit.
If I'm examining a lady's breasts, I'm hoping I'm not going to find anything. But clearly, I've always got to be on the lookout for something sinister.
But basically, your right hand will feel your left side and your left hand will feel the other one.
If you've got to break bad news to somebody, the secret is to always give them a little bit of hope and to break it in little pieces.
And you're feeling for lumps.
Yes.
You're feeling for things that are hard, like nutmegs. But if you find something, first thing is you don't panic.
Patients who are waiting to see Dr. Corrali, would you like to come forward, please?
OK, so you have an appointment booked for today at 2:45 and you want to cancel it. OK, I'll cancel that. Thank you very much for letting us know. That's by 2:45 cancellation, Dr. Savage. You all right, Ferdy?
In everybody's breast, we always find that there's a little bit of breast that creeps up underneath the armpit. It's called the tail of the breast.
Just a little bit of sensitivity under there.
Yeah. You're doing so well. It's very, 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 very good. Very good. The last little bits around the top here. Okay. Well, look, good news, there's no lumps.
Good.
Have a tissue. That was
just
difficult,
really
wasn't it? Oh,
That's all right.
look,
Okay.
you're being a really brave soldier because having had that accident, it's made you, shaking you up, it's made you feel really vulnerable, hasn't it?
It has indeed.
I think that knowing your patients is really very important as a GP, because with the time constraints, you've got to decide very quickly on in your consultation whether what that person is coming in complaining about is something very serious or it is something not so serious. Sometimes you don't get it right, but you've got to make decisions.
Okay, so what do you think?
There's all sorts of explanations for this.
Okay.
Could be a hormonal blip,
Mm-hmm.
which has been made worse by the shock of the accident.
Mm-hmm.
If you know your patients and they come in and they look desperately thin, or they look pale, or they look worried, you know that they didn't look like that the last time they came, and so there must be something wrong.
It could be part of the general shake-up. That could be what's making it worse. Okay? But at the moment, I don't see any reason to refer you to the breast clinic.
Okay.
Yeah, I've looked at you now, give you some anti-inflammatories, and we'll make a point of revisiting this in a month's time.
Okay, that's fine.
You're happy with that?
Absolutely happy.
Good.
Good. Thank you.
Okay. Hi, Jane.
Hey, baby, how are you?
I'm fine. Can't take a seat for me. How are you doing?
You changed your room. You're moving around, woman.
When did we have one done? Yeah. Okay, not to worry. So you get yourself ready for me, okay? And how you been, James? How was your weekend?
All quiet, watched all my sport, the cricket, the football. Yeah, I love me cricket. I want spring to come because I got that discount rail card I paid 30 quid for. And I get a day down the coast. Half price, see? Get a good weather, I can go to Brockley, change at East Croydon, go down to Worthing. I like Worthing.
You like Worthing?
Yeah, nice.
Well, I like Margate, but...
Margate?
Yeah, our friends live in Margate.
Yeah, that used to be the bee's knees, you know.
I know.
Margate, Ramsgate.
Right, relax this down.
Yeah. Oh, you are gentle, darling.
Right, there you go. All done.
Now, don't forget me blood pressure, darling.
You want your blood pressure done as well?
Yes, because I think you've put it up.
Hello, how can I help?
Can I just collect up a prescription for me, Stephen Harmon?
Hartman, yeah?
Yeah, how are you?
Yeah, I'm fine. Rest of the family okay?
Yeah, not too bad, thank you.
Good. When did you put your request in?
Come in. Amanda, how are you?
Never say never.
What is it that I can do to help you today?
Right, well, I didn't realise I was low on my tablets as I thought I was.
Right, OK. So this is mainly a visit to grab some tablets. I'm very confused by your medication list. So I was just thinking maybe we should just quickly fire through it and try and figure out what you are taking and what you're not taking.
I take all of it.
No, I know, but I think there's certain things on here which just... I just want to check. Make sure we're giving you the right things, right?
The amitriptyline apparently should be helping what I've got up going on the top of my neck, and I'm under the physio at Lewisham as well.
Good. How long have you been on the amlodipine for?
Quite a while now, because they've actually put me on another little one.
Is that the bisoprolol?
Yeah. And have they put the morphine on repeat as well?
Well...
Because I've been on it long enough now for it to be on repeat.
Well... Question is, do you want to be on morphine?
Well, no, I don't, but it does help with the pain.
Funnily enough, as a doctor and a GP, I don't want to give out medications to people. I only really want to use them when I absolutely have to.
My body's getting used to the 20/10, that's the only thing. And I know it can go up 2 more times, but I've got this big row with the job centre at the moment as well. They're trying to get me to go back to work, and if I don't find something or tell them that I want something, they're going to sanction me, which means I lose my money.
Right.
Which is not fair on me, because I know that I'm never going to work again. Because when my hands are bad, they're bad. It's enough to make just try and make a cup of coffee, and then she sits there. But oh look, I burnt myself over the weekend. I said, we're not talking about you. We're talking about me.
Okay.
When I first had pneumonia years ago, back when I was about 40, I was working for Iceland, and I was in and out the van. And you put the big coat on, you get shot because you're carrying all these heavy bags. So I'm sweat. Got pneumonia then.
Well, some people who end up in those sort of situations, get colds, etc., they don't get pneumonia. There must be something making you susceptible to pneumonia.
Well,
what do you suppose that is?
I haven't got a clue. You
really?
tell me.
You don't know.
I'm tired. I've only had 4 hours sleep. I had a bad night last night.
A lot of the problems that my patients have can be dealt with other things like exercise, diet, giving up smoking, not drinking so much. Those are the things which actually I need to be influencing and giving advice on in order to really improve the health of my patients.
How many are you smoking?
I've given up.
Have you given up?
Yeah. And this might smell of smoke.
I wasn't aware, because last month I think we got you down as still smoking and...
No. I think I might have had the odd 1 or 2, but that's it. Because they kept saying to me in hospital, give up. I said, I've given up. What's wrong with you people?
Okay.
I've just done it pure willpower.
Good. We'll see what effect the tablets have had on you, but it needs to be 3 months down the line.
Right, okay.
All right, Amanda?
Thank you very much.
No problem. All the best.
Wreck the joint before I go out.
Bye-bye. Take care.
Good afternoon, St John's Medical Centre. Sarah speaking. How can I help? No, Orlean, I don't have anything else today now. It's booked for you at 3:10, but I can't make it any earlier.
Hello, Mr. Gulai. Good to see you again. Please take a seat. Sorry I'm running half an hour late today.
Yeah, so...
What's been happening with your symptoms? Because you had quite a bit of pain, burning sensation after eating, acid in the back of your throat, worse when you lay flat, worse after alcohol. Is that all kind of, am I remembering correctly?
Yeah.
Great. And that all sounds to me very much like acid.
Okay.
I think you had a few concerns that it might be to do with your heart, but I hope I put your mind at ease. There's one thing I wanted to do, was I wanted to get the stool sample.
Yeah.
Okay?
Yeah.
To make sure there wasn't a bacteria that was causing the symptoms you were getting. But what happened was you submitted a urine sample.
Yeah, urine sample, yeah.
But it was meant to be a poo sample.
Oh.
So the urine sample, that didn't help.
Oh.
And then you didn't pick up the prescription.
Yeah.
So we kind of haven't really moved on as I would have liked to.
Okay,
but it's not a problem.
All right. So I don't need to fast for this one, huh?
No. This is just a poo sample.
Yeah.
But
what is poo sample? What's that? It's poo.
So you need to poo. That's where all the problems started.
Okay.
You gave me a urine, a pee sample.
Yeah.
But I needed a poo sample. Okay, a stool sample. So yeah, feces. That's what we need, because that can tell me whether there's bacteria in the stomach. Sorry, I wasn't making that clear.
Okay.
All right,
No
so
problem,
that's the key. That's the key. I'll be upset if we get another urine sample.
No.
Blue for poo. Easy to remember.
Okay.
All right.
What's his date of birth, please? And is this rash just come up where?
I mean, I can do a letter for you that says about the fact you've got epilepsy and about your other conditions as well. And then you talked about your mood. Tell me more about your mood.
I've been feeling really depressed lately because of a lot of personal issues. Everything that pretty much could possibly go wrong in my life has. I've been feeling kind of like suicidal at points as well. And just sort of like come home and like cry every night pretty much, and not feeling sociable at all. Don't really like go out, and I just feel like really down.
And then what specifically happened? So you said that there've been some things happening, but what's happened?
My granddad died, and
I'm sorry to hear that.
my brother was stabbed. My mum and my stepdad are getting divorced, and plus my boyfriend also is in prison as well, so that's quite stressful. and just sort of, I feel like I'm under a constant battle with like my sort of conditions and stuff. And like I just feel so worried.
You talked about feeling suicidal. What is it you thought about doing?
Just like, because I just don't see the point of going on, because I just don't have no one there for me at all, just to comfort me, even, not even, because I'm not really much of a talker anyway, just to like have that bit of comfort, you know, just to have a hug and say everything's going to be all right kind of thing. And so just like ending it really.
What is it you thought of doing to do that?
Just like slitting my wrists and just like chucking myself under a train.
How's your sleep?
Not good. I've never been a good sleeper anyway, but there's not really a lot I can do about it because of the medication that I take for my epilepsy.
And you talked about feeling suicidal. Would you ever act on these thoughts? Would you ever act on those thoughts?
No, because I'm not a selfish person, and I know that I'd cause a lot of hurt to a lot of people if I'd done that.
Because it's important, if you are feeling suicidal, that you need to let us know or someone else know, because we don't want to see any harm coming to you.
Yeah.
Yeah.
But I wouldn't do that because I'm not a selfish person like that. I wouldn't do that to them.
Have you suffered with depression in the past?
Yeah, but like not on, like, you know, bad things have like gone on, but you know, it's just not onto the good grade that I feel at the moment.
We can refer you for counselling here if you want.
I've never been a great fan of counselling because I'm quite a private person, and like I said, I'm not really much of a talker. I can take everyone else's problems on board. Like, I'm a great listener, and I could just sit there for hours for someone talking to me and listening, but I don't really like the idea of just talking to some random person.
And have you thought about anything like antidepressants or medications? Is that something that you've thought about?
Yeah.
So one of the theories behind when people get low in their mood or depressed is that one of the chemicals in the brain is low. So antidepressants help to boost up that chemical. Quite often, you have to take them for at least a month before you might see any benefits of taking the antidepressant. You can get side effects. Common side effects with antidepressants tend to be nausea, vomiting, stomach upset. Some of them can cause problems with vision as well.
Okay.
Antidepressants, I wouldn't say that they're a long-term solution. I think they can be good to help get people out of a rut as such, you know, in combination with other things as well, because you've got to look at different life aspects, and if there's something that's making someone feel depressed, to deal with that as well.
I guess it's something I can try.
Yeah, are you wanting to try one?
Yeah.
Yeah. Quite a big proportion of our patients that will come in with, you know, either depression or feeling low in their mood or anxious or in a distressed state as well. On a daily basis, I might see maybe 5 or 6 patients that are going through some sort of form of distress. Because of the other medications, John, I just have to double check about what we can give you.
Okay.
I'll get back to you at lunchtime today.
Okay.
All right then.
Okay, thanks very much.
All right, good to see you again.
St John's Medical Centre, Sarah speaking. How can I help?
Hold on, I can't. I need some more details. Could you tell me what the symptoms are, please? She's coughing, so she's got a cough.
Just breathe normally. I'm listening to your heart. Okay, good. Chest is nice and clear. Your heart sounds normal. The first thing to say is you don't need antibiotics.
Okay.
What you have is a cold. So it's a It could be flu, but even if it's flu is caused by a virus, and antibiotics don't work.
You haven't got no antibiotic I can take for sore throat?
Nothing, it wouldn't work.
Really?
Yeah, the sore throat's going to get better on its own in 2-3 days.
Serious? No antibiotic? That's what I've come up for.
I'm afraid I've got bad news for you. Cough can last 10 days to a fortnight at least. Giving antibiotics doesn't help the cause. No antibiotics for the moment. Self-help, steam, lozenges.
Okay.
But I haven't got any magic wand.
Just say, Wow, that is pretty clear cut. So that tonsillitis is so bad, you definitely need antibiotics. I mean, that's a clear-cut case. So if any one of your friends asks you, doctors don't like to give antibiotics, that's the kind of classic case where you need antibiotics. It's pus, it's very swollen, your glands are clearly up. If those tonsils get any bigger, like if you actually find that, get a kind of ooh, that kind of noise, any hint of a noise like that, you have to take yourself down to A&E.
Does the effect of smoking affect it?
Smoking's not going to help it one bit. Had any thoughts about quitting smoking at all?
Yeah, I tried it for a week.
You tried it for a week. How many would you smoke a day?
20 a day.
20 a day. Before you're 30,
yeah.
If you just stop now, that's £26,863.
Yeah.
How much pleasure does smoking really give you?
Calms the stress.
Not as much as a £26,000 holiday, all expensive paid.
Yeah, well, that's like in 10 years. So.
Well, but this is still real.
Great. Got a gap. Woohoo. Somebody not turned up. Marvellous. Perhaps I can grab a coffee.
I'm going to go and eat some cake now. Bit of gattox.
I can help you today, Dwayne.
My mum passed away last year, February. I haven't really grieved. I ain't seen counselling or bereavement classes. I just haven't got time, to be honest, and that's me being honest. And I've got to be strong for my kids. I come up with some little rash just before Christmas, and I'm trying to keep my stress levels down, but my armpits are sore where it's flaring up there now. Crease in my arms, it's sore. My neck is sore. My face is sore. And that is stressing me out because my eyelids are getting itchy and sore. But my face has taken a piss. That I'm going to get stressed because it's really tender now.
Yeah. Okay. Do you want to pop your jacket off and let's start by having a look at your arms?
I've never suffered allergies. I don't know what's caused it. I've dealt with stress since I was 8. My mum's had asthma, diabetes, high blood pressure, blood clots, arthritis and rheumatism. I've dealt with stress. I've never had nothing like this. It's already sore, especially this part of my belly.
Yeah.
It's like it's inflamed. And I don't know what it is. My friends keep telling me it's not psoriasis, but I don't know. I've never had skin allergies.
Yeah, so there's different types of psoriasis that you can get, and where you get the big flaky bits, that's called chronic plaque psoriasis. This looks like a slightly different version of psoriasis.
Is this common?
No. I mean, by far the more common version is the chronic plaque psoriasis. This is different, yeah, and
will this go away, or am I stuck like this for life?
No. We will get rid of this for you. Don't worry. It's gonna be better than it is. This is not satisfactory for me or you.
Anna, this was the girl in call back.
Who is she?
The same one that you just spoke to.
What she want now?
The same thing she's arguing about.
Same question, Ella. Same question. The answer doesn't change.
Yeah, as you call back.
Yeah.
Which day did I last come to the surgery?
That might have been the dad, that phone, because the dad sounds like a woman.
No, the daughter.
The dad's got
She's
a good
very
woman like
rude. It's a rude family.
Because one time out of courtesy, I phoned them about Dr. Parker's appointments, and he went on and on and on and on and on and
St. John's Medical Centre, honey. How?
I phoned man twice, Colin.
I mean, psoriasis, if we're treating it correctly, it improves, but it doesn't improve like in a week. It takes like 4 or 5 weeks of sustained treatment, which
That's
is
what I heard. It would
would
take 5 weeks. That's what the hospital told me. 5 to 6 weeks.
The one thing that I would add in, which you haven't had yet, is a steroid. And I think that would really help with the soreness and the redness.
Okay.
As hopefully please. The sun comes out a bit more. And we will encourage you to get out in the sunlight a bit more as well, because sunlight helps to improve this as well.
What about sunbed? I've never used it before, but I jump on out of that to get rid of it. I'm serious. I don't need to use it, but I jump on it if it gets rid of this.
Yeah, it probably would.
Probably would.
It would probably help. Yeah. That's not to say go mad on sunbeds.
No, I wouldn't go mad. I don't need to go mad. I've got an all-year-round tan. It never peels, never fades. But this is annoying me because I don't suffer from no allergies.
We will see what happens over the next couple of weeks. Like I said, if you feel it's getting worse, just come back and we'll get you seen by the skin specialists.
Okay then.
Great. And yeah, I mean, ultimately coming back to, you know, the stress that triggered it all off. I mean, is your mum, the loss of your mum, is that something that you think you would like help with at some point? Or?
To be honest, I do security. I do between 60, maybe 80 hours a week. I physically ain't got time.
You ain't got time.
Yeah.
Life's in the way.
But I'm all right. I know my mum would want me to be strong.
Really fill your boots. Go. Going, keep going, keep going, keep going, keep going. Keep going, keep going, keep going. Keep going, keep going, keep going, keep going. Keep going, keep going. Stop.
Hello, sir.
How are you?
I'm good. How are you?
I'm all right.
Last time we met, you were due to go back and speak to the surgeons about the operation for your colitis. Any further thoughts about whether you would consider the surgery?
You know, I don't want to have a surgery. I don't want... You know, they want to take all of my bowel out.
I know.
Which is wrong, you know. I don't want to be, you know, abnormal person. If this is better if I go with my sickness and die one time. That's good, yeah. But I don't want to look, you know, someone who is abnormal, to have a bags every time. I don't want it. You know, I hope that I will get better or die, you know.
Think about it this way.
I will.
You know, if you have an operation, you don't have to worry about being up 5-6 times a night, always needing to be near a toilet, constant blood, and the diarrhea. All of these experts, they're pointing towards the same thing. Yes, you'll have a bag, but in day-to-day life, you know, that's something that you'll become accustomed to.
You know only what you think, but still I believe that I will get something before that.
What do you mean?
You know, or some technology will come, or it comes by itself. So maybe it will go by itself.
That's a very optimistic point of view. However, we haven't seen any miracles yet. There are no cures. This has been the standard management for many years.
I will think about it. Let me think about it. Let me see. Yes, it has not any other option, then of course I will go. But let me, yeah. Okay. Let me think later.
Would it be possible to see a doctor today? It's a bit serious. I found some blood in the urine.
Okay.
It's a bit worrying, you know.
How are you feeling today?
When I'm lying and I keep tossing and turning in the bed, because of the pain, the bandage just go down, you know what I mean? And sometimes when it goes down, it gets tight down the bottom.
Is it painful still down here?
To be honest with you, it's painful from the stump of the big to go around. God.
I've injured my foot. I went quite a long walk on Saturday, and I think the boots are rubbing on this big toe. It was a massive blister.
Let's have a look at it. What I think we'll do, because it's a hot, sweaty area, you've got an open wound, there's a huge potential for germs to get in.
Right.
And what concerns me is if there is a bit of redness, is this the first signs of an infection?
So what I'm going to do, Mr. Phillips, this bit over here, just going to put a bit of Inodine on that, OK?
Twice a day,
Yeah.
you put that foot in hot, soapy water, not
Yeah.
too hot, so you wash it really thoroughly.
Yes.
Then you dab it dry, or use a hairdryer to dry it,
Yes,
so that it's completely dry.
Yeah.
And then you put the antibiotic cream that I'm
Yes.
going to give you, and then you can cover it with a suitable, appropriate plaster.
Okay.
You okay?
Yeah, come on.
This is just on lightly, okay? There you go. You feeling okay?
I'll never feel okay, really, will I?
My name is Dee. And,
Thank you, Dee.
and you too. Now, this is just a health check, very basic health check, OK?
OK.
If you have any medical problems, then it would be a GP that you make an appointment with, OK?
Yeah.
So where have you moved from?
From Greece.
Straight to London?
Straight to London.
Oh, how long have you been here?
About 4 months.
What do you think?
I love it.
Do you?
Yeah, I love English people in London.
What made you decide to come and live?
Here, it's so big, your country is so big and there are many opportunities.
Yeah,
and
true.
the thing is that you are organized.
Do you think so?
Yeah, I like organized countries.
I've had an awful lot of trouble with this printer here. Just don't seem to be able to get it to work.
So what's wrong with this? Oh my God! Oh.
You don't know how to use none of the equipment them in here.
Yeah, no, you
and
have to.
all you girls.
Sure.
You trying to hide? Huh? You trying to hide from me?
Come and have a seat. Hello.
Oh.
How are you these days?
Oh, well, most things are fine.
Yes.
Same old, same old. My sleep.
Oh.
It's terrible, and I've not had a good night's sleep for a couple of years.
You've got to a sort of certain age now.
Oh, God, yeah.
Do you think the menopause has got anything to do with this?
Oh, yes, I do.
Are you
But
getting
I think
hot
I
flushes?
did. I was.
Sometimes it helps, to cope with the lack of sleep, to have what we call some talking therapy.
Yeah.
We've got some superb counsellors, if only just to sort of help focus on how you feel and how you can cope when you haven't got any energy and
Yes, all the
you can't
time.
get through work.
All the time.
If up here is not at peace with the world,
Yeah.
how can you expect to get a good night's sleep?
Yeah.
OK, well, have a think about it.
Right.
But let me put this to you. We're not superhuman, and just sometimes we need something to kickstart us into feeling better.
Yes. Yes.
I've known you long enough to know that actually you have been coming to me with this problem.
Yes.
And perhaps now's the time to try different tacks.
Yes.
How does it affect you? Like, are you aware of it? Are you conscious about it, or does it not bother you?
Doesn't bother me.
Doesn't bother you. Okay, good. I don't know. Did my colleague tell you it's called pityriasis alba?
Yes.
Yeah. With this type of pityriasis alba, unfortunately, there's nothing that we really know kind of makes it better or worse.
Maybe antibiotic, maybe.
It's not anything to do with a bacteria or an infection or anything like that. It's getting better, and hopefully at some point it will be gone. What I will do, I'll give you a tiny little bit of hydrocortisone, 1%,
Okay.
and you can put it just on these patches around there, not around the eye because the eye is very thin, but just for 3 days, just once a day, just for 3 days, and then don't use it again, and just see if that makes any difference. Some people say it does. Any other questions? Is there anything that's worrying you at all?
Anything question? Just put it. Soak.
No.
Are you interested in anything to do with those leaflets? Your mum will be even more worried.
I need them.
Do you?
I want to read it.
Are you just reading out those for interest, or is there something you want to talk to me about?
No.
You sure? All right, okay. Well, the door's always open if you ever want to come back and talk to me about anything from my broad selection of information leaflets.
But you know about that?
Yeah, I think so.
You'd be surprised how frequently patients will come in and they won't actually tell their doctor why they're there. And it's really important that we know about that. And we do have a term for it. It's called the hidden agenda. Essentially, your main tool for everything is listening, and there will always be cues.
So you basically just tick that box and hand it in. They'll put Telus off and just hand it in. Okay, when you need another one.
Also, the body language. If someone looks uneasy or they're avoiding eye contact, you just pick up on things.
Nice meeting you.
Thank you.
Take care.
Bye.
Do you want to talk to me about it?
No, I just need it.
Can you just give me 1 second? I'm going to ask your mum. Do you mind if I have a chat with you alone for 1 second? Without your mum, would that be all right? Do you mind if I just have a quick chat with Semi-Solo alone, just for 5 minutes?
Okay.
Yeah?
It's really important that young people and children feel able to speak openly to their GP, and sometimes that'll be about things that they certainly wouldn't want to speak openly about with their parents, for example. And I think it is important sometimes, even if someone is, say, under the age of 16, to have a moment of privacy.
So, the ones you were looking at were these two. What was it that made you think that you might need some of these?
I don't need them. I just need to get something. I can't reach it.
What do you mean, get something?
I dropped something.
Whereabouts?
In the heater.
And you want one of these?
I need to get it. I've dropped my 50 pin. I need to get it.
Okay, so you don't need anything. You don't know what these are all about, and you don't think you need what these
Just grab them.
All right, okay.
But obviously, yes, sometimes our intuition isn't spot on.
Well, you know what? I'd rather you didn't use my information leaflets to get your 50p. Maybe try a ruler. Do you have a ruler at school?
Yes.
Maybe use your school ruler or something like that.
Hello, Gypsy.
Would that work?
Yes.
All right. By all means, have that. Okay? Take care.
Bye.
Cheers. Nothing to worry about, okay? Take care.
Okay, thank you.
Oh dear.
All right.
Friday.
Has she offered any explanation as to why she's, 25 minutes late? 25 minutes late. I mean, I'll see her. It's fine. Okay, bye.
Morning, St John's.
At 10:30, Dr. Opong. Opong. O-P-O-N-G.
Okay, bye. What can I do for you today?
Right, I don't know how it's happened, but I've cut myself underneath and my testicles are really, really swollen.
Okay.
Yeah, it's very, very uncomfortable. I sleep in the nod, yeah. I don't know, maybe there was something in the bed that I didn't realise was in there, I don't know, but it's very, really, really sore. The wife's obviously put some cream around there, but the pain's really, I can't bear the pain anymore.
Swollen and sore, and is the pain constant, or do you get sudden jolts of pain? Describe that to me.
Constant.
An aching pain?
I wouldn't say an aching pain. I feel like that I'm going to pass out.
Tell me about when you go for a wee.
It's It's very uncomfortable when I go to the toilet.
Around your groin or the testicles or the penis?
No, the penis and the testicles.
And is it a burning?
It's like a burning pain, but a sharp pain. It's like someone's poking me with something.
All right. What we'll do is we'll examine you and get you to do a urine sample. Do you think you could go to the loo?
Yeah, of course I can.
Is it tender at all?
So you say you're having bubbling urine?
Yeah.
Ciao, my name's Brian. I'm very well, thank you. What can I do to help you today, then?
Right, I'm starting to be a bit irate, right? I've had a confrontation on Thursday. I filled him in, right? I punched him in the face, and that's made me scared because I'm not dangerous like that, right? As you know, and you got it on your record.
Who was it who you hit?
My friend, who's a security guard. I'm trying to calm down.
Yeah.
Because it's all my nervous system, from my fingers here to my toes, and especially my head. It's like it's on fire inside and all that. You know what I mean?
So let me just check that I've understood this right, Brian. Yeah. So at the moment you're finding that you're feeling a lot more tense and angry at the moment at the world.
Very angry, that's right.
And you have this tendency to lash out at people when you're feeling that way.
It's mainly frustration, that's right. That's what is causing it mainly.
Okay.
Because
Do you think that mentally you're not coping as well at the moment for some reason? Because ordinarily it's not in your nature to get this angry and hurt people. No. So is something making it a bit harder for you to tolerate people at the moment?
Yeah, that's right, because...
And what do you think that is?
It's because Cameron and what he's doing, really, and all these idiots he's got around him, you know, it's really annoying me. And my mobile phone company, they know I'm blind and all that. They keep sending me text messages and I can't read them.
Not particularly useful, no.
So I find that's taking the piss out of my disability, you know. You know, and that upsets me. That's upsetting.
Yeah.
And he doesn't want to grab them and kill them.
The NHS computer system is absolute crap. I can't get into my computer. It doesn't like my...
No, that's what you go on at the beginning, isn't it?
Yes, well, that's what I was trying to get in on that.
That's not that one.
Yes, it is. I can't understand starting late.
Now it's doing it. That's your card code.
That's the number I always do.
Yeah, so you're going into it now.
No, we're not. Not yet. Don't be so optimistic. You're not in until you're in, Chris.
All right, so... Yeah, you are swollen, aren't you? OK. I'm just going to lift up, see underneath. Where was the cut you saw?
Just about here, I think it is. Yeah, right there. Ooh.
Let's get you seated again.
What do you think it is, Doctor?
I think there's probably an infection in your testicles. There's a little bit of blood in your urine, which might be an indicator of infection. So 2 weeks of antibiotics, then you'll see Dr. Ferdinand.
Right.
Obviously, if things get worse in the interim, come back sooner.
Yeah.
Once this infection has settled, we can bring you back and then have a proper examination to make sure there aren't any lumps and bumps that shouldn't be there.
Yeah.
OK, that's your prescription. So let's just see how you get on.
Yeah, that's absolutely fine, Doctor.
OK.
OK, then.
All
Thank
right.
you very much.
Mind how you go.
Cheers.
Bye-bye.
Don't touch anything.
No, not until I can see it on the page.
You're in.
No, it's not yet.
It is.
Not yet. Wait.
It's in. Why does it do it? I don't know. It hasn't done it for me.
So how are you going to bring yourself down to help you calm down a bit and relax a little bit more?
Well, that's why I've come to see you, really.
Yes.
We need something to sedate me or, you know, not to put me out like that, you know.
Yes.
But something milder, if you like, you know.
I was just looking at your medications in the past.
Yeah.
And back in 2011, you took olanzapine for a period of time. That's a tablet we sometimes use to calm people down.
Maybe a tablet like that would help, would it?
I wonder. I'm not sure I want to use that now.
With regards to mental health, obviously there are medications which we can use, but I think they are not always the best and first thing which should be turned to. And there are other things that can be done, such as counselling, other therapies, good lifestyle choices like eating well, exercise. These are all things that can have a really positive impact on mental health.
It's frightening, really, in one sense. I don't want to be a nuisance to you and the public. You know, I don't want no convictions or no violence at all in my life. You know, I don't want to shoot someone like my doctor or anybody.
Well, yes. How are you sleeping at the moment?
Sleeping. I normally go to bed about 3 o'clock. So I'm getting about a couple of 3 hours at night, and that's about it, really.
What's keeping you up till 3 in the morning?
Well, all I'm doing is watching the telly.
Telly's rubbish after midnight, eh?
The TV and all that is a voice, you know. So I feel comfort from it.
Would you say you feel lonely?
No.
No?
No, I'm not lonely, no.
No?
I like my own space. Okay. And I like to be on my own.
So you're happy in that respect?
Oh, in that respect, I'm really happy and all that.
In 2010, when you were feeling quite low, you were hurting yourself. How did you harm yourself back in 2010? Do you remember?
You get my knife from the kitchen.
Yeah.
And cutting.
You were cutting your arm.
Cutting my wrist.
Right.
And all that up here.
You're not thinking about doing it.
And your knees.
You're not thinking.
And your knees.
Right.
And stabbing the knife in your leg.
Right.
And saying, here, feel that, you twat, you know. Feel this, and all this, you know, which is dangerous and self-harm.
Yeah.
Right, which you shouldn't be doing.
Are you doing anything like that at the moment to yourself? You're not harming yourself?
No, I'm not cutting my arms or putting marks on me. No.
Do you think it would be worthwhile speaking to someone about how you're feeling at the moment and about these feelings of frustration and anger you're feeling?
Yes, I think that would be great.
Okay. I can arrange that. I can do that by referring you somewhere called Southbrook Road. They're the Community Mental Health Trust.
Oh, yeah. You don't have to be a mental to go there.
God, no. The vast majority of the people who go there actually enjoy pretty good mental health. It's just sometimes some people need a little bit of help.
Yeah.
Nothing wrong with that.
Okay.
Okay.
Well done, mate. It's all good, you know.
Indeed. All right, let's help you gather your things up. Right, Brian.
Thank you very much.
All the best. You're going to be okay finding your way out?
Yeah.
Good. Take care.
Thank you very much.
Bye-bye.
How can I help you today?
I've just got a bit of a lump under my chin. You can have a go on it if you want, it's just there.
To me, it doesn't feel like anything sinister.
Cool, thank you.
Have a seat. How are you?
Okay.
Okay.
Fine. I feel fine in myself, yeah.
We had some results to go through. Is this why you've come?
Yes.
I hope so. Yes. I tested you for diabetes. No signs of that. Blood count, no anemia. Kidney function, fine. Cholesterol level, no. It's 6.7. The upper end of normal should be 5.
Okay.
It's a measure of the sort of fat that's floating around in your body, and we get excited about it because we know it's one of the big risk factors, fat and blood pressure and smoking, for heart disease. I suppose the first thing to say is, what's your diet like? Vegetables.
Yeah.
Vegetables and fish.
Vegetables and cakes.
Got to have some naughty days. You can't say no to cakes completely. But actually, cakes are what we call quick fixes. You get a sudden burst of sugar, but it doesn't last. If you were to take your carbohydrates in the form of something like, say, porridge in the morning, that'll keep you going because it's releasing the sugar slowly. So porridge, cereals, pasta, they're all releasing their sugars slowly.
If only there was a magic Gosh, I must have been for weight too.
Yes, there's no magic wanders for weight. But diet, losing weight and exercise can actually reduce your cholesterol levels.
Yeah, I mean, I know exactly what I should and shouldn't be doing, so
Yeah.
I'll give it a go and I'll try.
Give it a go. You can actually get 12 weeks of free Weight Watchers.
Wow.
Just think about it.
Yeah, definitely. I can see you.
Okay?
Okay, meet you soon.
Good, bye-bye. I hope she does something about it.
All right, so that's 5 o'clock then. Okay, thank you. Bye-bye.
I've got my thing tonight, ain't I? My Weight Watchers start tonight.
Excuse me, please.
This is my area. I can't breathe.
That's why you go Weight Watchers.
Oh, leave me.
And my stomach, yes, most times there's nice pain in me. Yeah.
Do you get any feeling like being sick, vomiting?
No, I just feel pain.
Yeah.
I'm feeling pain.
How's your weight been?
My weight is all right.
Yeah. And how about your appetite?
Yeah, it's okay.
Any diarrhea?
No. Blood coming out sometimes.
Blood?
Yeah.
Is it in the toilet bowl, the blood?
No.
So it's only when you're wiping?
Yeah.
Because of the symptoms you're having, would it be okay for me to examine you?
Yeah.
So I need to check your stomach.
Yeah.
The other thing is because you're having bleeding from your back passage.
Yeah.
For people with those symptoms, we'd normally examine your back passage. Okay. Have you ever had that done before?
No.
Okay. Now I'd need to take a look at your back passage. And obviously I'd have some gloves on. And then using some gel, I would examine your back passage with my finger.
No problem.
Okay. Are you okay for me to do that?
That's fine.
Do you want a chaperone? Are you happy for me to go ahead? Do you want someone to chaperone while I do that exam?
Yeah.
No, do you want someone to be in the room whilst I do that exam?
That's all right.
Okay, so first I'm just going to take a look at your stomach.
Okay.
For all intimate examinations, we would offer a chaperone to people. Because quite often your patients might come to a practice with a range of different symptoms and they wouldn't expect to do a personal exam because that's maybe not what they had in their mind. So I'm just going to gently press. Just a sec. Lie on your left-hand side, yeah? And then let me know when you're ready.
I have to take my trousers off, yeah?
Well, you can just lower them just so I can see your back passage, essentially. Tuck your knees up towards your chest. I wouldn't say it's difficult to do an intimate examination because it's something that you do throughout your training, so you do get used to doing intimate examinations. And that's why it's important that you're reassuring the patient that this is actually quite a normal thing and there's no need to feel awkward about it. Okay, so I'm just applying some jelly to your bottom end. It'll feel quite cold. And now I'm just gently advancing my finger through.
Yes.
Okay, so if you want to get dressed and then come back outside.
Okay.
Yeah.
I don't know what's causing that blood sometimes.
You've got a pile, which is what's causing the bleeding. Have you heard that term before, hemorrhoid?
That's what I was thinking.
Okay, so around your bottom end, you've got quite a lot of veins there. They carry blood, essentially. So sometimes when people get symptoms of, say, constipation, as such, have you felt constipated yourself?
Yeah.
You have been? Okay. So I can give you symptoms of bleeding. So there are different things you can do to try and help those symptoms.
Yeah.
One thing is eating more fibre in your diet. There are some creams that I can prescribe for you that you could apply to your back passage to try and help those symptoms as well.
Okay.
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 Yeah.
Hello, this is Dr. Ferdinand calling from St John's Medical Centre. You know, we took a couple of urine samples from you last week. They came back negative for chlamydia and gonorrhea, so there was no evidence of those.
I can't sit here and tell you that you definitely don't have prostate cancer, but at the same time, you're within normal range now, which is fantastic. You brought that right down.
They did a lot of random biopsies, and your IBS-like symptoms are just IBS. They're not colon cancer.
That's fantastic news. Thank you. Thank you.
We're in business.
Yeah, it's normal. Okay, thanks. Bye. It's normal. Your chest X-ray is normal.
So, last time I saw you, you had this problem with your toe.
That's right. And I went.
And I was a bit worried about it. I asked you to get some blood tests to check for diabetes. And I'm sorry to tell you today that your blood sugar results did come back very high.
Very high. Oh,
okay?
Yeah.
So
it's looking like diabetes.
I'm afraid so. In fact, I'm certain you have diabetes. Diabetes is a serious diagnosis because it's such a wide-ranging condition. The fact that the sugars affect your eyes, affect your kidneys, and diabetes is in itself a risk factor for heart disease.
Right.
Yeah, it's not something to be taken lightly, but at the same time, at the age of 60, we've got lots of years, hopefully, to get in control of things.
Type 1 diabetes is a failure of the body to produce insulin, which is a hormone that regulates your blood sugar levels. And type 2 diabetes is a resistance to insulin. So the insulin that you do produce doesn't have the same effect. Undoubtedly, type 2 diabetes is a serious diagnosis, but there aren't many conditions where the patient themselves has so much control over how things will progress and reduce the chances of serious things happening massively.
Now, the way we go about treating that is, first of all, we give some tablets. Probably the biggest thing is the things you do in your lifestyle, so diet is absolutely key.
Yes. Plus, I'm a drinker, so will that be knocked on the head or?
What do you drink?
Mainly lager.
Okay, I was worried you were going to say that. So, I mean, alcohol in general isn't going to help you.
No, of course not.
But all these alcohols have high sugar content, especially a pint of lager.
I thought that,
Okay.
I can still work though, can't I?
What do you do for a living?
I work on the construction sites.
Yeah, so...
Because that's my living, I need to get money.
Yeah, having diabetes is not going to stop you from being able to work on the site.
Yeah.
But you need to also be aware of just what's happening with your blood sugars, because I mean, we're talking about the rest of your life, 30 odd years. We need to get this diabetes under control, and that will take you time to manage your diet and to figure out what's bad, what's good. Actually, that's all you need from me in terms of paperwork for now. I'll give you a prescription now as well.
Right.
We might need a couple of different tablets to get your sugars under control.
Do your fist for me. Now I've got to pinch an inch. All right? Keep your belly nice and relaxed, okay? Very good.
All right, sharp scratch.
Right. Any allergies to anything that you're aware of?
No.
High blood pressure?
No.
High cholesterol?
No.
Thrombosis, clots in the legs or the lungs?
No.
Diabetes?
No.
Glaucoma?
No.
And breast cancer?
No.
Have you ever had HIV screening?
I think I did, but it was years ago.
Right. Do you want me to do it today?
Yeah.
Yeah? Let me feel your hands. Are you warm? So this is an instant result.
All right.
1 dot is negative and 2 would be positive. There you go, you've got a nice negative dot there.
Phew.
It's amazing how many people suddenly think when you say to them, oh, it's a test, you can have the results straight away, they go, oh, OK. What, you mean now? What about chlamydia screening? Have you had chlamydia screening recently?
Not recently.
Do you want to do that as well? You can do that yourself.
Okay.
What you do for that is you just go to the toilet, wipe yourself, pop that much into the vagina, and then in the pot.
Okay.
All right, and the toilet's right opposite.
Hi, is it Miss Strong? Hi, please come in. What can I do for you?
I'm here about my coil.
Okay.
I've had in over 5 years.
Okay. Were you hoping to have it taken out today?
No, I want to keep it in.
Oh, right, okay.
If I can.
Fine. I think, to be honest with you, if you've had it in for 5 years, it's better to come out.
I've been fine with it. I've had...
Fine. I mean, the last set of blood tests that they did suggested that you might be postmenopausal now, and at 53, I would expect that to be the case.
Post.
So, as in, your periods might have stopped now. So, rather than leave this in for a long period of time, more than the recommended time frame, my gut instinct is it should probably come out.
I've had the menopause.
That's what the blood test would indicate.
I haven't got no hot flushes or anything.
Not everyone does get hot flushes. Not everyone finds it, difficult. But that is some people. Yeah, the menopause affects people in various different ways.
The hot flushes, I'm not really too bad on that. I might get the one maybe a month, if that.
Yeah, no, I don't get the hot flushes.
So I don't get the hot flushes really and truly. I don't experience that. But what I've noticed with myself is that I'm so snappy.
Yeah, me too.
Bad-tempered.
Yeah, me too. Yeah.
It's like I want to kill anyone who gets... It's not even funny because it's like I have to check myself sometimes.
Yeah,
do you know what I mean?
Of course. It's not sure somebody will say to you, why did you do that? And you think, did I?
Don't know
that you did.
It's got to be menopausal.
Was there anything else you wanted to ask about? Was that it today?
What's this like? I noticed that I keep having, my vagina in there. You know that bridge bit, it keeps splitting now and again.
Okay.
Like a paper tear.
Rough drawing, where are you talking about? Is it the back passage or is it actually the skin of the vagina?
Right on the muscle bit in the middle there. Like a little paper split.
Okay, and does it bleed?
No.
Is it just very sore? Okay. Well, that might all correlate to the fact that you might be postmenopausal now. You can get vaginal atrophy postmenopausally, where because you don't have the estrogen going around, the vagina will actually get a bit dry and actually can shrink and can get problems there. So I think this is all kind of part and parcel of the same picture, really. My gut instinct is that we take the coil out, we can start giving you some estrogen cream for the vagina that should keep it supple and avoid getting further kind of tears or irritation, things like that.
Yeah.
Does that make sense?
Yeah.
All right.
How are you?
Not good, doctor. I keep feeling terribly sick, nauseous, and then I get a cold sweat, and then I get a terrible pain across the top of my eye here, just on the one side. The pain don't go away. I've tried every tablet, and it's even to touch it, it's sensitive.
Okay. So when did this start?
I've had it for a couple of weeks now. It's continuously coming and going.
And how would you describe the pain?
It's like a toothache in my head. If you touch it even there, it's so sensitive.
Yes, so it's the pain that you can make worse by touching it.
Just by touching it.
Right, may I check your blood pressure, please?
Yes. Do you know what it is, doctor?
Well, I think it's a migraine.
Oh, sugar, I've never had them before.
Is there anything else going on in your life that you...
I'm just down all the time, constantly. And I'm going today to, would you call the people the psychologists?
Yes. Are you worrying about that?
It seems strange, I don't know.
What's your biggest fear?
I just feel that it makes me inadequate if I'm attending something like that. Do you know what I mean? I feel a bit worthless and a bit silly.
OK. We could look at it a different way round, though, couldn't we? Think about your body a bit like a car that has to be serviced. It's got to be looked after. It's going to go wrong from time to time.
Yeah, true.
So you take it to the garage.
Yeah.
And the garage has a look, has to do some tests. And then they'll come and tell you, they say, well, look, actually, there's nothing really seriously wrong. It's just a little bit of a loose this, that, or the other. Or they might say, unfortunately, there's lots wrong and you're going to need to buy a new engine or whatever.
Yeah.
It's hard to imagine the rest of the body behaving normally if up here is in a turmoil.
Yeah, I feel low and down sometimes, and I think...
Yes.
Well...
And I think that that's one of the reasons they thought you might want to try an antidepressant.
Yeah.
Stress and depression are the bread and butter of our work. Very common indeed. And stress can be very important in many different illnesses. If I'm looking at a condition that somebody has, I might say, yes, this is the physical condition that they have, but what about the psychological element that could be making it worse?
This headache, this migraine, if you like, it's the way your body is showing that it's under stress. But what we've got to try and address is what's causing it in the first
underlying
place.
Thing, yeah. It's just been everything.
Just keep talking to yourself and say, look, I haven't got anything to worry about at the moment because we don't know the facts.
Yeah.
So put that bit of anxiety in an envelope.
Seal it up.
And seal it up. OK? and concentrate on what is working well. I can do this, I can do that.
I mean, I feel quite fit, do you know what
Yes,
I mean? And I think, well, I'm going to be 69 this year and I still feel quite good, do you know what I mean?
Absolutely. Keep on with that.
Whatever I'm doing quite right.
And try to just sort of enjoy what you're doing.
Yeah.
Try to wallow in the good things in life.
I've got to try and fill every day with something that's going to be beneficial to me, even just going for a walk.
You've got to do things that are going to make you happy and that you enjoy.
Yeah. Not bar of chocolate.
Yes, what a good idea.
Yeah.
Now, can you keep still and let me do your blood pressure, do you think? Oh, yes. I mean, this is definitely stress, isn't it? Right. These little tablets you take for the sick feeling, right?
Yeah.
And I'm proposing we give you the slightly stronger cocodamol to take, right? I hope you feel a bit better sooner, and I hope it's helped to have a little chat about things.
Thank you, Jan. I'll make an appointment next week to see if these have helped me as well.
Yes.
Thank you very much.
OK, bye.
Bye-bye.
How are you today, sir? You're feeling particularly low at the moment.
How have you been in yourself?
I'm trying to cope, but still, because it's still the same.
Mm-hmm. Is it hard?
Sometimes.
Yeah.
Yeah, sometimes.
What's happened recently to make this the worst day of your life? OK. Well, look, I'm booking you in for an appointment at 3:40. You're not a hypochondriac. Take care. Bye-bye.
Now, he can be a bit squiffy for a few days with this, all right? So if he's a bit loose, don't worry.
You've got such a hard life.
Oh. Right, so sit him like that, nice and relaxed, yeah?
Yes.
OK.
I'm trying to be.
Oh, you're doing very well.
Right, I'm not going to look. So
No,
tell me
just
when you're doing it.
Relax, just relax, OK? He's going to...
My heart is beating.
It's all right. All right. You're doing well, you're doing well. So, there you go. It's all done, look, see? Oh. When somebody wants me to hold their baby for them, I can feel just as nervous.
Okay, have you got some tissue, please?
Yes, darling. Oi, mister. I'll get away with you.
All right, Mummy's sorry.
4 weeks' time.
What's he got to get done then?
He has his second diphtheria, tetanus, and his meningitis C. And he has.
Injection?
Yeah.
Gosh, I can't do it.
Look, he's all right now. He's just whinging now. You're fine. Man up. Come here, give us a cuddle. What you like? What you like? Hey? I've always been able to communicate with children. You see them evolve, and one child, she wouldn't even come in the door. She'd sit in her buggy at the door, and I'd say to her mum, just leave the door open, that's fine, she can stay there if she doesn't want to come in. And then the next time she came in and she stayed in the buggy. And then I've met that child all the way through, and now she's an adult working, and I still bump into her, and we get on really well, and I've seen her develop as a child into a young woman, and it's great. Right, what time do you want? 9:30?
That's perfect.
Are you all right there, your hand down my cleavage, mister? My dog does that.
He does that all the time. It doesn't matter who it is, he does it.
We've got to let them develop. And that's what I love. I think they're so funny.
Thank you.
Are we going to get a smile before you go so your mummy knows you're all right? Look, he's fine now.
Did you have a problem with your medication? Uh-huh. Okay. Okay, you're welcome. Take care, bye.
Hello? You're still limping, Ian? Is it no better at all then?
No, the lump's not gone down at all with it. They phoned me up this morning, sir, can I come back to work today?
No, you can't come back to work.
They want me back this morning.
They wanted you back?
Yeah.
Come in. Hello. So, you mentioned the lump.
Yeah.
Let me see it. So whereabouts do you feel your pain?
It's around there.
It's around there?
Yeah.
OK. It's been a little over 2 weeks now, and the pain's no better at all. If you come lie down, I can work out whether it's your hip or your knee that's causing the problem. Right. So, bend your knee for me. Hang on. Relax. Just relax. Let me move your knee. Can you bend your hip a bit more as well?
No.
Does your hip come up any higher?
No, that's how high it comes up.
That's as high as it goes. All right. Does that hurt?
Yeah.
Can you sit? Can you sit on the edge of the couch? Might be easier if we get you to sit. Great. That's right. Just. Oh, does that hurt? Sorry. Yeah. Let's get you up. Sorry.
Right.
Didn't mean to cause you discomfort. I think the problem's your hip, because your knee seems to be moving quite well.
Yeah.
And it's your hip that's actually really struggling to get much movement out of.
Yeah.
Would you agree with that? Or?
Yeah.
I think maybe we should get you referred to see the specialist about your knee and your hip.
Right.
All right, Ian. Yeah, do you want a tissue?
Right.
I take it you're not too keen on the idea of having to have further operations.
I'll be right. Last time I said it was 50-50.
If you want to try to avoid an operation, then the thing to do instead would be to have some physio and seeing if that helps.
Yeah.
But unfortunately, arthritis tends to be progressive. It tends to get worse with time anyway. So, I mean, would you like to try some physio first, or do you want to be referred for...
I don't mind being referred to see the doctor again.
You'll see the doctor about maybe having the operation?
Yeah. Can I go back to work yet? Or not?
At the moment, do you think you'd be able to manage the pain?
No. They wanted me back this morning.
I know. Maybe if we give you a couple of weeks more off, and that gives enough time for hopefully the knee and the hip to settle down a bit more.
They want it straight away, they said. They won't get paid otherwise.
We'll take that then, quick. So that covers you from the 10th up until the 24th.
Yeah.
Yeah, I'll get the paperwork sent off. I'll ask them to see you as soon as possible. Okay?
Yeah. Bye-bye.
Bye-bye.
Thank you very much, Doctor.
Take care.
See you later.
Bye.
Mr. Tappenden, hi there. What can I do for you today?
Yeah, basically what it is, Doc, I'm a diabetic, so, you know, my levels have been quite high, and I think I might have a urine infection.
All right. How high is high on your sugars right now?
22.3.
Okay. And where do you normally sort of run at?
Well, normally they run at about 5 or, 6, I mean.
Yeah, so they really have shot up.
Yeah.
You've had quite a few urine infections, is that right?
Yeah, on and off, yeah.
Okay.
Yeah.
What are the symptoms you've been getting?
Just like a burning sensation,
It burns?
Yeah.
Okay. And are you peeing more often than normal?
Yeah, more often, yeah. Just continuously all the time.
Right.
Yeah.
Okay. Have you seen any blood or anything in
No,
it
it's
at all?
not blood.
Right.
It's not blood.
Any cough or
No.
difficulty breathing, headaches?
No.
Rash?
No.
Nothing else like that? Diarrhea?
No.
Bowel habits fine?
No. Yeah,
Okay.
they've been all right.
I think the first thing I'll do, if you don't mind, is just dip the urine.
Yeah, sure.
Wait and take it from there, okay?
Yeah.
There's a lot of glucose in your urine,
Yes, sir.
but there isn't much evidence that there's a nasty infection going on. You shouldn't really get a significant burning sensation from just sugar, but I think going to the toilet a lot, going to the toilet very often, is classic of your blood sugar not being very well controlled and being much too high right now. I think we need to get your sugars better controlled, and I think that's going to mean cranking up the insulin slightly. I think we should go to 12 in the morning and 10 in the evening. And I think we should see you early next week with the results of the urine sample to make sure we haven't missed any infection. Although it doesn't, I don't think that's what's happening.
Right.
All right? Okay.
Okay, yeah.
Take care. Nice meeting you.
So I just need to examine her.
Yeah, that's fine.
Hello, cheeky.
Think of the 3 pigs and the wolf outside going huff, puff, blow your house down. That's the house. In. Get out of it. Try again, go on.
And if you were going to score it, say, 10 being the worst pain in the world, like having your arm ripped off by a lion, and 1 being like bitten by an ant, how would you score it?
10.
This pain in your stomach is as bad as having your arm being ripped off by a lion.
Easy.
That's it. Well done. Well done.
Hello.
Yeah, please.
Jordan, this way. Jordan, no, this way.
What's up with Jordan today?
Right, I've just got a little problem with the way he's behaving. I'm just wondering, has he got some form of autism? I was reading on the internet that kids that line their toys up, line up their toys, because he does it like all
Lining
the
up the
time.
toys. Okay.
And he knows all the planets. You know, he just lined them up. Jordan, no, come this way. Jordan,
Okay.
sit down. Okay?
What else?
And sometimes he's like this, he just laughs unconditionally.
No.
Jordan, can you stop?
And how does he get on with the other kids his age?
Fine. Teacher said he's fine. You know, Jordan, can you stop, please?
If Jordan wants something, can he tell you about it? Can he tell you, I want this
Yeah.
book, I want that book, I want to watch this, I want to do that, I need something to eat, I need something to drink?
Yeah.
I mean, you're right, autism is a spectrum. It goes from very severe to barely noticeable, to be honest. What you described about being quite obsessive about one thing. Yeah, that ritualistic behaviour of lining things up. Yeah, those are 2 features of autism.
Yeah.
But there's also features of normal 5-year-old kids as well. Okay.
The internet has a really interesting role in healthcare. I think once people have their diagnosis, it's very easy for them to then go away and research what the treatment options are themselves. And that's great. I really welcome that. I want my patients to be really well informed about their conditions. But I think the one thing that the internet's not very good at is diagnosing. Usually if a patient has tried to diagnose themselves on the internet, I'd say 9 times out of 10, they're probably wrong.
Autism is a social communication disorder. It's your inability to be able to interact and socialise with the world around you.
Yeah.
It sounds like he does fine.
Yeah.
To line up the toys, that's every kid does that. Lots of adults do that. We all line things up just because that's the way we are.
Okay.
It doesn't make us autistic. It just means that is a little idiosyncrasy of some people's behaviour.
Yeah.
He seems like a pretty normal
5-year-old.
to me.
Okay.
All right.
Thank you.
No problem.
Jordan, come on, time to go. So thank you to doctor.
Thank you.
Bye bye.
Bye.
It's time for the weekend.
Right, I've put that in for you. You're welcome. Okay, bye.
This patient was so happy that she got an appointment at the time that she wanted. But she goes, oh my God, thank you, darling. God bless you.
What are you doing this weekend?
Watching my TV with my teddy bear.
Good morning, Putney Mead. How can I help?
How can I help you? That will be Dr. Neil, and that will be between 9 and 11 this morning.
We've got one appointment left, 8:38, that's doing well. I remember sometimes by 8:09 we've booked it all out, literally.
So, because we've got a bit longer, what I've done is sort of made a bit of a list of things to talk about.
All right, love.
So, why don't, before we go into that, were there other things that you wanted to talk about today?
Doctor, can I ask a question?
Mm-hmm.
If a woman is married to a bloke and he beats her up, like black and blue, right? And she comes and sees the doctor and he says, where'd you get that? And you said, is your husband beating you up? And the mother, turns around and says to the doctor, yes. Can the doctors do something about it?
Why did you ask that?
Can they do that, doctor? I know everything's changed now.
What makes you ask about that now?
No, it's... I wanted to ask you.
Well, of course, we could always help.
I wanted to ask you, didn't I, Richard?
Yeah, because we was
I like
that
things-
trial and retribution.
It's like...
So it's like this, Doctor. The man shouldn't hit a woman, and a woman shouldn't hit a man. See, so...
No, we never done nothing, nothing's done nothing like that at home.
No.
The staff have been very good.
Yeah. Okay.
Anyway,
But you two are all right?
yeah, fine.
Yeah.
And you said you was going to mention the doctor and about your bum.
Every time when I eat something, he goes right through my stomach. It gives me diarrhea. And my bum has been very sore. I've been wiping it, but it's been very itchy.
Okay.
And when I go, I pass swings
Mm-hmm.
in my bum.
Yeah. What about pain in your tummy? Are you getting anything?
No.
Does your tummy get bigger, have you noticed?
No.
No, it doesn't sort of puff out.
Yeah.
Okay. And from what you've said before, it sounds like there hasn't been any blood in there or anything.
No.
No, good. Okay.
No.
Fine. Is it better when you're not going to the loo so often?
I know when I do a big poo, my bum gets very sore. Oh, the very sore.
You have to give it a few flushes before it really, gets rid of it.
Yeah. Yeah.
You know what it's like, Doctor.
I do.
Yeah.
Oh dear.
Hello.
Good morning.
How are you?
Not good, not good. I had the worst cough and cold I've ever had in my life.
Did you?
I had paroxysms of coughing every few seconds. In the end, I had to just hold my mouth shut and just cough internally because it was tearing my lungs apart. It's a cough that comes from down here. It's not a light cough. It's really a hacking cough.
Right.
I call it my graveyard cough. You see, it's very difficult for me, and I don't really expect you to believe this, but the work I'm engaged in, there's a lot of occupational hazard.
What is it you do?
I'm working in a healing ministry, it's a Christian healing ministry, and of course it overlaps a bit with what we call the deliverance ministry.
People will go off on tangents often when they're talking about their problems, and actually it's not really, not all of it is very relevant to that particular problem. Although they may think it is very relevant, it doesn't help us diagnose, we make a diagnostic decision really about what the problem is.
When you go into the enemy's territory, he doesn't like it. And the devil is extremely clever at coming in under disguise. I mean, this morning, I just suddenly felt so ill. And then I thought, oh, this is just his back to his tricks again. And I find that it's what I call an attack from the other side. It's not a genuine thing.
Right, well, with regards to your cough, I'm just wondering what the next step should be. I didn't really address it. It was one of those moments where you just think, well, that's a bit, I don't know where I'm going to go with that. sometimes one of the medications can cause your ankles to swell, and one of them can cause a cough. So I'm a bit reluctant to increase any unless we need to. Now, I think the sensible thing would be to check your blood pressure again in a couple of weeks, and then we can make a decision. Okay.
Well, thank you very much.
Good morning, Planning Need. Rachel speaking.
My stomach's growling already. It just went... Can you get me some peanut biscuits and a packet of McCoys or something, please? Thanks. Bye.
Oh, is it one of your homemade concoctions?
Well, me and my mum made it.
Oh, what's got a big bit?
Come in, have a seat. Nice to see you again. Yeah, how are you?
Yeah, good. Yeah, well, yeah. I really just want to renew my medication, really, and
yeah.
But I've got a bit, I must admit, Dr. Vajo, could you help me out with something to sleep, please? Because I think I'm sort of, I know my brain would just want to let me sleep, you know what I mean?
Okay.
I was sort of becoming a bit insomniac and only getting sort of a couple of hours, you know what I mean?
Okay, why do you think you're not sleeping?
My brain just won't let me, you know what I mean? There's too much going on, like, I'm trying to close my eyes and I'm not happy, you know what I mean? No.
Anything in particular going on in it that you think might be stopping you from sleeping? Is there anything upsetting you or stressing you?
Probably, yeah.
Okay, and what do you think those things are?
I can't put a finger on it, you know what I mean?
Can we just check you over a bit? Is that all right?
Yeah, sure.
All right, okay. Just want to take your jacket off for me. Just undo that for me.
I can't. I can't.
So you're living in a tent at the moment?
Yeah.
Take a seat.
Yeah, the reason I've come to see you is out of the blue, they stopped my climber valve.
Right.
Now, I knew nothing about it was stopped because I should have seen someone in March. Nobody told me I should see someone in March with this electronic stuff. How do you know?
But the pharmacist should be relaying anything that we pass on, so that it's because it's a new thing. I think there will be some hiccups. So I'm really sorry if it hasn't worked out for you.
But then I've also been attending this surgery more than any time in my life, probably, and I just think it's rude, ignorant, thoughtless to actually stop something without even telling me.
It was stopped in June.
But you see, because I only take one every other day, Dr. Andrews, I wouldn't have ordered them since then.
That's absolutely fine. But as responsible prescribers, we have to know that you've understood the risks of being on HRT at this stage in your life, and we have to document that. So, you know, your risks far outweigh the benefits at this stage when you've been on it for this long, and that's what all the research is saying and continues to say. So I think it's really just so that we can be sure that you understand that staying on it increases your risk of breast cancer, increases your cardiac risk. There are other, you know, it does carry risks with it.
But so, I think it's up to me to weigh up the circumstances that I'm prepared to risk.
It is entirely up to you, and our job is to be absolutely certain that we just keep reminding you what those risks are, because that's what our job is. So it is entirely up to you. I entirely agree with you, but that's what that's about. That's what's happened. So
well, if
I can
told,
reinstate it. So I'm not going to put this in your Dosset box in that case.
Right.
But I'm going.
Oh, that's right.
Yeah, exactly.
Just leave it to me to order it. Excellent.
Good.
Anyway, lovely to have met you.
And you.
Dr.
I'm glad we've
Andrews.
managed to sort that out this afternoon.
Because I came in here absolutely. I had steam coming out of my ears. I really did. And said that I was going to sit downstairs and sing "I Will Not Be Moved" until I saw somebody.
She means it.
And your name?
Hello, Patty Lee, Lorraine speaking. How can I help?
Hi there. Are you okay?
My GP surgery doesn't do injections, they don't do blood tests, so actually this is an exceptional practice, to be honest.
How much do you normally drink in a day, Stephen?
3 or 4 strong cans a day, yeah.
And any thoughts of cutting back on your alcohol or getting a bit more help with it, or does your outreach worker help you with that?
Yeah, well, he is from a drug and alcohol organisation, yeah, sure.
Have you got your outreach worker's number?
Yeah, I have. It's good.
Can I have it?
Yeah. Yeah, his name's Charlie. Sorry, mate. No,
do you want me to do it?
Yeah, if you can.
Yeah.
Yeah, see if you can do it. Oh, someone's right. Oh.
That's him.
Yeah. Is that Charlie?
Yeah.
Can I talk to him? Alright, Charlie.
I can speak to him actually.
Okay, no problem.
I can speak to him actually.
Yeah, sorry, I'm with my doctor. He'd like to talk to you.
Oh yeah, okay.
Yeah, I'm here now. Right, okay. There you go.
Hi, is that Charlie? Charlie, hi, I'm Dr. Buveja. Stephen's just turned up to see me today. I was actually just asking him to get me your number. I'm sure you might be a bit busy at the moment. Do you mind if I give you a ring maybe in the next couple of days? Is that all right?
That's fine. Yeah. Give me a call tomorrow.
Yeah. Cheers, Charlie. Bye. Bye. Is it all right if I talk to Charlie about you?
Yeah, of course. Yeah.
All right. I think today you seem a little bit like as if you might have had quite a lot to drink.
I've had a bit to drink.
Yeah?
Okay.
Will you make an appointment to see me in about a week? Is that all right? And maybe next time just come with a little bit less alcohol on board, if that's all right. Just so that I can understand you, really. And that we're not jumping around. Is that all right?
I know where you're coming from. Right.
Thanks very much.
All right.
Cheers.
All right.
All right.
Lady needs an urgent appointment, so I'm going to put her on now.
Doctor, just do me a favour. Can you put your finger up my bum, see if I've got a lot of poo up there?
Well, I think it'd be helpful, actually. Yeah, let's do that. Just relax, Teresa. Well done. Sorry.
Ooh.
Well done. Good.
Good boy.
We'll talk about it in a sec. So get yourself dressed first, and then we'll have a chat
Is my
about it.
bum sore?
Doesn't look too bad, actually.
Have I got poo up there?
No, nothing that I can feel in your bottom, but it doesn't mean it isn't higher up in your tummy. So I'm just going to have a look at the computer to see if we had that X-ray of your tummy, all right?
All right, love.
Yeah, so hold on a sec. No. You do have to go to Queen Mary's for your X-ray of your tummy.
My tummy?
Because an X-ray can help us when we're wondering if there's lots of poo in your tummy.
Yeah.
I think that'll be a helpful thing, because I'm trying to get a reason why sometimes you're having these runny tummies, really.
Yeah.
Is that all right if we get that done?
All right, love.
Okay. So get them to make the appointment for the blood test and for that thing.
All right,
Okay?
thank you, doctor.
That's the blowing test. There you go.
All right, thank you, doctor.
And do you, what soap do you use?
Well, I use body wash, my darling.
Because I think your soap maybe dries your skin out a bit.
If it gets bad, I'll have to come to you.
Okay.
Yeah. I like your jacket, by the way.
Thank you very much.
It's nice, isn't it?
Richard, leave Dr. Ernest Flowers alone.
Okay. All right then. I'll see you soon.
All right, Doctor. See
Take
ya.
care, Richard.
Bye.
Bye-bye.
When I grow up, I will be a doctor.
Do you?
Yeah.
Oh, it's a very interesting job. You get to meet lots of lovely people. Oh!
Warm this up, shall we?
Hello.
Oh, you're quite heavy.
If you open up nice and wide for me and say ah. Say ah. Hello, sweetie. Is it a bit tickly?
Yeah.
Is that a bit tickly?
Yeah.
Come in. Hello, Mr. Hart. Hi, come on in. Hi there. Come on in. Right. How can I help?
It's just sometimes I get palpitations and I get the odd dull pain in my arm.
Can you describe it?
Just like a dull ache, really.
Look at that helicopter.
It's like a headache feeling, but except in your arm.
And how long would it last for? Is it all there all day?
A few seconds.
A few seconds.
A couple of minutes.
A couple of minutes, okay. And what are you doing normally when it comes on?
Right, can you and let me talk to the doctor? I just ignore it. Just getting on with things.
Okay.
Ashley, please.
Ashley?
Ashley, right. You've been warned so many times now.
Probably
right.
should
Now,
maybe
come and
not
sit
touch
down here now.
Thank you. Sorry, so...
I was recently diagnosed with a hiatus hernia that came up in a chest x-ray.
Mum, I think there's going to be a storm coming.
I can't concentrate. Please, can you be quiet?
Look, I think there's going to be a storm coming.
Probably right.
It's not. It's going to be sunny until Saturday. Right, can you stop?
There's lots going on, isn't there? How are you managing?
It's tough, but I manage.
Managing.
I've got gallstones, as you know.
Yeah.
I've had history of gallstones.
Right.
And I've also had history of heartburn.
So, and what was it
indigestion.
If you've had this as the same pain for some time, what was it that made you call up today specifically about this pain?
Because I keep feeling lightheaded.
When did that start?
Just this week.
All right. Has anything else changed recently?
No. Ashley, please.
Some consultations are completely chaotic. And that can be because of the GP, the things that the GP is dealing with, or the chaos of the patient's living. And you can literally see it playing out in front of your eyes in the room. It's quite difficult to keep focused. And I'm always worried that I would miss something. And that's often where the discomfort is for me. I actually think it might not be a bad idea to get some tests done to rule out the heart as a cause of this, okay? And actually, probably the best way to do it would be through the hospital for the cardiologists.
Oh, okay, yeah.
All right, so you'll hear from them.
On there, yeah.
Blood pressure and the pumps.
Brilliant. Thank
All
you
right.
very much.
Look at me. Look at me.
So I think I do keep my cool, but I worry that I've missed something. As people walk out and as the chaos leaves, I'm always left thinking, you know, what have I just missed? There's something else there. Hello. Is it Mr. Morris?
Yes.
Hello, I'm Dr. Ernie.
Yes, good morning. I usually see Dr. Andrews,
Yes,
with a
I
good
saw that.
relationship, but this is a man thing.
Okay.
It's not a matter of embarrassment, it's just that
Yeah, that's fine.
she doesn't have a penis and you do.
Okay.
I just need to have my testicles checked. They feel swollen.
Okay.
They feel heavy. So I noticed it 2 or 3 weeks ago during warm nights when I sleep naked. When I swing over, they sort of go clump, you know.
Yeah.
There's a slight pain at the root, as though being pulled.
2 or 3 weeks you've noticed this?
2 or 3 weeks ago, or just realising, you know, it's a warm night, but penis, as you know, gets very floppy, but it felt more floppy than usual.
You've also written on here low libido.
Yeah, I'm just turned 75. I've not had a sexual relationship for years, so if I do masturbate, it takes some time to get anything more than a...
Really? Okay. Yeah.
I mean, I've been giving it more attention because of this. So.
Yeah, no, of course. Have a seat up on the couch.
What's your date of birth?
You're very welcome. Take care.
And the name?
Archie. Oh, I love that name, Archie. Hello. Could I have an appointment, please? I'm sorry, he probably doesn't sound anything like that. No, he doesn't. He's only born in 2003. Hello, it's Archie.
How are you getting on?
Since I last time saw you, I'm out of tablets for blood pressure.
When did you run out of tablets?
A couple of weeks ago. I've been a bad boy for the last 2 weeks.
Yeah, well. So, and how are you feeling in yourself?
I think so. I'm feeling much better.
Are you?
I'm feeling much better.
How are the stresses? Do you remember last time you were going through a lot of stress?
Comes and goes, you know. I think it's my nature. I can't let go things quickly. I want everything perfect in my life, you know, especially in the business, you know.
Okay.
So if something is off a little bit, I get very uptight.
Right.
With my staff and all that.
Okay.
And lots of my friends have said to me, Ash, you need to chill out.
I mean, we had this chat before.
Yeah.
You're putting yourself at a very high risk.
Yeah.
I'm being serious because actually we're not talking about 10, 15 years down the line. If you carry on like this with these readings, blood pressure, with that lifestyle, heart attacks and strokes are a very real possibility for you. How will your wife manage if you have a stroke?
Difficult. I've seen people with stroke, and I have an uncle had a stroke nearly three years now, and he's in a home care, and all his money, what he's earned, is going in, being looked after, can't move, can't talk.
Okay.
He's like a cabbage sort of thing. You know, I've seen a friend passing away, so I think...
So you've experienced it close up.
Experience, yeah.
And so I think we need to make some changes now, and I agree, and I would support you. We talked about work stress.
Work stress is the biggest problem, and then another one factor is my dad living with me, and it's getting a bit... I know he's 89 years old, it's my responsibility to look after him, but it's just getting sometimes a bit irritating, you know.
Okay.
Sometimes, you know, he makes a lot of mess in the kitchen, and when I see it, I said, what is this, Dad? Come on. Things I tell him, don't do it, just leave it there. He keeps on doing it and makes a mess. And that boils me up, you know.
I'm just wondering what might help you. What techniques could we try, or could you try, to stop yourself getting to the stage where you just boil over, suddenly going from nothing? You're not going to be able to change him.
No, there's no way I can change him, you know.
But we might be able to focus on how you change how things affect you.
Yeah, okay.
Because I think that's where we could start.
Okay.
You can't change him, but how do we change the impact on you?
Okay, all right.
So you're in the same situation, but you approach it differently.
Okay.
I mean, there are other options. We have other options. If you're getting very stressed with this issue, you know, we can always think about a few sessions of counselling where you can just explore this with somebody who's not related to your family, and you can really work through what options you have.
Okay.
And I think we need to do this together. So what tablets do you need today?
I need the whole, everything.
And then can you have a think over the next 2 weeks, between now and when we touch base, what else might help you to manage the stresses?
Okay.
You know, just have an ideal world. What would help you? What do you need to do? What do we need to focus on? We'll do the blood pressure, but what else might help you to focus on the stress?
Okay. All right.
Yeah?
Okay. All right.
Between us, I think we can then get there, because otherwise, all of the stuff I do is not going to be worth it if you're going to go off.
I understand that.
It's
not. It works both ways.
Yeah. So if we're happy to do that.
Yeah.
Hello, Putney Mead, how can I help?
Do you want to go and take a seat on the first floor?
Mr. Ackerman.
Doctor, how are you?
Fine, thank you. Nice to see you.
Nice to see you.
Right. What can we do for you?
I've had an operation on my ear. He had to rebuild my eardrum.
Okay.
Completely. When I came out of hospital, it was brilliant. I was jumping up and down. I could hear with both ears. But I had an infection, and ever since then, it's been driving me insane. Doctor, I am having a hell of horrible time. And I get the most throbbing headache, the mother of all headaches, I kid you not, and it hurts. It really feels...
Is there pain in the ear?
Yeah, everywhere. I get it all over. It makes like a bubble noise. Brr, brr. Do you know what I mean? It's driving me absolutely insane. I wish to God I'd never had the operation. I really do.
Right.
Now, the past couple of weeks, I've been losing my balance.
Right.
Nearly fell a couple of times. I'm a chef, you see. And I'll be honest with you, Dr. King, I'm very, very worried because I use twin fryers and the temperature is 190 degrees. And if I fall head first into one of them, you might as well serve me on a fish and chips as well, or whatever.
I'm just feeling for any lumps in your groin there. Okay. So I'm just going to check your penis as well as your testicles. All right. And where's this pulling discomfort that you get?
It's really at the root.
So I'll just examine your testicles, okay? Good, that's fine. Would you mind if I examined your prostate?
Yeah, what does that mean? Put your finger up my bum.
Yeah,
Yes.
that's right. Is that okay?
Yeah.
So the way to do it is roll over and face the wall.
Yeah.
And well done. Deep breaths. Oh, that's it. That's fine. Why don't you pull up your trousers and come and have a seat and we'll talk it all through. Let's have a look. That was in the past. Okay. Your testicles, from my point of view, feel normal.
Right.
And your prostate felt fine.
Mm-hmm.
Slightly enlarged, but a normal shape.
Mm-hmm.
And what's reassuring is
they feel normal.
They do, exactly. With testicular cancer, if it's causing a heaviness to the testicles, they do feel remarkably different actually from normal. They really feel very heavy from our point of view. So the fact that yours don't feel like that and they're a normal shape, no extra lumps, is very reassuring. In terms of the erection change and the low libido, it might be worth checking your prostate blood test, but also your testosterone, just to make sure there's no sign that either one of those is abnormal, just as a so that we're covering all the bases, really. Okay?
Yep.
All right.
Thank you very much.
Not at all. Nice to see you.
Stop me if it's sore when I'm doing this, okay?
Right.
It's still wet and red. And
Sorry?
It's still wet.
And red.
And red, and
Very red.
there's exudate covering it. We'll take a swab, but we also need to do something as well. We can't just leave it like that. Let me just touch this on the inside. Sorry if this is a little bit sore. Sorry. Sorry. Okay, all done.
Did you see a small little hole in there still, no?
I can't see the eardrum. It would be better to have you seen by the surgeon that did the operation, but it's not a complicated problem. It needs to be looked at and it needs investigation. So I think that is probably the way to go. That we can get you seen in that clinic.
Can you give me tablets for it or anything to?
We can give you some tablet antibiotics.
Yeah, that'd be nice if I can hit it with that. So I'm amoxicillin, yeah? We'll hit it with that.
We'll try.
Yeah, no worries, Doc. You
No
guys
problem.
do a great job, so, you know.
All right.
Thank you for your time.
No problem.
Lovely to meet you.
And you. Wrong way.
Wow.
That way.
Do you know what wins a skeleton then? Do you know why? I think it's the chemist. Hello. Hi, can I pick up a prescription, please? Hello. Hello.
Hello. How are you doing?
Oh, well, not doing very well at all. Really, I'm getting out of breath. It all seemed to have happened in the last month, really.
Just getting worse.
I'm not sleeping well, and in fact, Saturday night, I just couldn't breathe.
Have you seen the surgeons yet?
Well, they said my ventricle in the heart was closing up slowly, and that was why they said I should go see about having something put in to widen it up again. And I assume that's causing all the shortness of breath suddenly, is it?
Yeah. Well, if they do surgery, they will probably try to do it as minimally invasive as possible. So they might do it by going in via the wrist or via the groin and trying to open up the valve that way.
Yeah. I mean, if I was going to go, fine.
Yeah.
But if I'm going to find I'm worse off,
Yeah.
you know,
There are some risks of people having a stroke and things like that during this type of procedure.
yes.
The worst case would be that you didn't make it through.
Yeah.
But I think if you do nothing I think your symptoms are steadily becoming quite a lot worse, aren't they? I felt I needed to make him aware that, you know, his illness is a life-threatening condition, and the natural process of that condition will be that he will steadily deteriorate and eventually die, albeit in an unpredictable time frame.
What do you think? If I didn't have it done, probably what? I've got about a year?
I think that's notoriously just such a difficult thing to be able to predict, I think.
Yeah. I mean, my main thing is not so much going, but I don't want to find I'm going to spend months almost like a vegetable.
Doctors most certainly should not always intervene to save a patient's life through treatment. It completely depends on the individual situation and the individual patient, of course. In medicine, we always try to do good and not do harm. And so in some cases, intervention can cause more harm than good. And if they choose to decline a treatment, then you have to respect their wishes and respect that that's their choice. I think we just need to really await this appointment with the cardiothoracic surgeon.
Yeah, and if anything, obviously it suddenly gets worse, I suppose.
If things become, very critical and that overnight, then, 111, or if you feel it's a real dire emergency, then 999.
Yeah.
Okay.
Yes. Okay. Nothing I can do about it, is there? Yeah.
When the time comes, whether I will have intervention or not, I think it is it very much depends on the situation, and I think until that time comes, I can't probably easily predict my decision, but within reason, I'm sure I would mostly want something done, if at all possible. All right?
Okay. Thanks for your help.
You're welcome. Take care.
What can we do for you?
Okay, very simple. I have a hemorrhoid, and it's excruciatingly painful. Yes. Yesterday had some spots of blood on toilet tissue.
Okay, you've had these before, presumably, or
many years ago.
Right.
Yeah.
And you're fitting well otherwise?
Yes.
Should we have a look?
You can. Yeah, I've had a shower.
Fine.
I'm going to Italy next week, and I just thought, please go.
Yeah.
Just go before I go to Italy.
Oh, yeah, okay. I'm just going to... Just tell me to stop if it's too tender. I'm just going to put a finger inside. That is a nasty pick. It doesn't actually look like it's thrombosed yet, which is what happens sometimes.
Right.
When they get sort of clotted and then they become sort of almost permanent. Right, you get yourself dressed up and decide what to do. Now, when are you going away?
Tuesday.
There is a sort of rapid access, or sort of piles clinic, if for want of a better word, that runs at St George's, but it's on a Thursday, as far as I remember.
I'll be gone.
Be gone.
Yeah. Yeah, I'm going to, we're going to southern Italy, Bari, do you know it?
I don't know. Sounds nice, though.
And whilst we're there, I'm proposing, so we shall see.
So you really want these under control, don't you? Is it all planned then? Have you got a?
Yeah, bought the ring. I thought I'd just go for a nice stroll across the beach, and then just go down on one knee as the sun's coming down, and see if it all goes well. And if it doesn't, she's going in the sea.
Okay, so I think the thing to do really at this point is to treat it as much as you can.
Okay.
Now, it's on the sort of anal verge, so it's partly in, partly out, and as far as I can examine, there was a suggestion of some little ones slightly higher up as well.
Right.
So what I will give you is some suppositories.
Yeah.
And some ointment as well.
Okay. So what do I do with the suppositories? Just push them off? Delightful. Right, okay.
All right.
Yep, thank
well,
you.
I hope it settles down.
Okay, wonderful.
All right.
Okay.
Bye now.
Have a good day.
And you.
There was this woman came in and she wanted to register her unborn child
and I was like, well, if it's not actually like on the earth yet, I can't like register it. And I was like, wait till it comes, you know?
Come in. Come and have a seat. Okay. So you've had a rough few days, haven't you?
Yeah.
What does the pain feel like to you?
As if I've been beaten.
Really?
What about when you lay down? You can't lay down.
I can't
because
lay
of the
down on
pain.
my back. I can't put my back down.
Do you want to take your jacket off?
Yeah.
And if I press... Oh,
yeah.
It's sore, isn't it? Oh, it's sore all along there, isn't it?
Oh, yeah, it's bad.
Goodness me. Do you want to lie down? You can show me where it hurts. Might be useful. Because obviously we know you've got osteoporosis and your back is curved. I mean, sometimes you can get little fractures in the spine. Where's that hurting you?
Oh, right across there.
Where's that sore?
All across there. See, I've only got to move. I can't go on my back.
No.
Because of it, but it's hurting across
of
here.
the pain at the front.
Yeah.
It's difficult for me sleeping and everything. Oh, and then it's agony.
There's obviously pain in the chest there, which looks like it's coming from the muscles and the bones rather than coming from the lungs. Well, it's difficult to know. I mean, you can get an inflammation of the cartilages there called costochondritis. It's like an inflammation of the costal cartilages, basically. Come on, you sit up, make yourself comfy.
See, I haven't got any movement like that. I'm in agony all the time. I went to the hospital, but I mean, they weren't particularly bothered.
They were bothered, Mum. That's why they gave you the painkillers and the antibiotics.
But you've no idea the pain I'm in.
We do.
I can see.
It's all so depressing. Oh. See, it's only that I sort of pulled myself up and
it gets you. There is always the possibility of, Queen Mary's Hospital has Bryson White ward, which is like a rehabilitation type ward. If we're finding it difficult to manage the pain at home, I mean.
What about calling it respite?
I mean, is it something that you would consider?
don't know.
You're in pain, Mum.
I don't want to go in hospital.
But it's not like going into an acute hospital. It's it's like it's more of like a rehabilitation type unit. Mrs. Emanuel I've known for a long time, and she is a fiercely independent lady. She always comes in looking immaculately dressed. Her house is immaculate, and I think she's very proud of that and wants to be at home for as long as possible. But things had really come to a crisis point because unfortunately she's recently been diagnosed with Alzheimer's disease, and we weren't sure whether she was remembering to take her painkillers. I guess the benefit of going somewhere like Bryson White would be that we could hopefully get you better quicker.
Yes.
Should I make some enquiries anyway?
Make some inquiries.
Yeah?
I don't really want to. I want to stay in my own home.
But, Mum, you need assistance. You do need some
Need some
help.
help.
At the moment, you need some help.
I mean, I think if I was in Mrs. Emanuel's position, I, like her, would probably be the same. I mean, no one wants to lose their sense of independence and autonomy, and to feel that other people are making decisions for you. I'm not saying it's going to be forever.
No, no.
So leave it with me. Am I able to get you on the phone later, John?
Yes,
Yeah.
you've got my number.
Yeah, I've got your number. All right. All right, do you want a hand?
Any movement.
Got it. There we go. Okay. See you later. Okay, see you later. I'm really proud to be part of the NHS. It's the largest publicly funded health service in the world. And it means that everybody, regardless of wealth and income, has access to good health care.
Gracias.
Thank you. Bye. Bye.
People often ask me, well, what is it to be British? And I think the NHS is a fundamental part of what it is to be British, and something that I'm very proud of, and I think we should all be proud of.
That's all right, we'll find you on the system.
How can I help?
I've developed a rash.
Right.
Pretty much all over my body.
Right.
So this happened on Monday night was the first time I noticed it.
Okay.
I'll let you look at it, but
Yeah.
it looks a bit like chicken pox.
Okay.
But it's not chicken pox, I'm pretty sure, because I've had that.
Right.
But it's very much like...
So let's just have a look. So it's quite flat to the skin, but it's not itching.
Yeah, it's not itching.
And did it all just come up, or did you start with one spot?
No, it all came up.
It all just came up and it's not itching you at all?
The first time I spotted it was Monday night when I was going to bed. So I've been taking antihistamines for a couple of days.
That's not helped
It's
at
got neither
all.
worse nor better. It's
No.
just...
And also, so if it was allergy, you'd expect, A, it would improve with antihistamines, or B, it would be very itchy, but it's not
Yeah.
itchy. Infection-wise, you don't have a fever, you feel well, you've not had a sore throat recently,
No.
or any infection like that at all. I might see if I can pick the brains of Dr. Mackenzie next door,
Sure,
who's our
yeah.
skin guy.
Yeah.
Do you mind if I just quickly see if he's
Absolutely.
around? I won't be a second. Can I just really quickly pick your brains?
Excuse me.
Right, so there's a gentleman here with this is Dr. Mackenzie,
Hello there. Hi.
with a 5-day history of a rash. Started on Monday. It's not been itchy in any way. It's not responded to any antihistamines at all. And you're not on any medications?
No.
No.
Didn't start as one batch.
I thought I asked that.
Came Monday night, took my clothes off to get ready for bed, and I was covered in it.
Right. You know, they're all
see.
sort of leaf-shaped.
Yeah.
One has to ask the question, no risky behaviours?
Absolutely not.
Good. There you go. Adults with a rash, you got to think of that.
Yeah. He's been well in himself. He hasn't had a fever, no preceding sore throat or anything like that.
I reckon that's pityriasis rosea.
Yeah.
That's a classic sort of sign there.
What, they're scaling?
Yeah, they're sort of scaling. I reckon that's what it is. So it normally take 10 to 12 weeks before it's sort of completely gone.
Okay.
You know, no creams will really make it better. Okay.
Brilliant, thank you. Okay, do you want me to print you off a little information leaflet?
Yeah,
about
that'd be helpful, yeah.
Yeah, the rash, there's a nice photo of it here. That's probably
That looks very similar.
quite similar, isn't it? Not contagious, so won't spread to other people.
And so just expect it to kind of disappear over the next number of weeks.
Yeah, 2 to 10 weeks, but can last as long as 5 months. But hopefully it will be sooner than that.
Don't plan to go on any beaches between them.
No, just cover it over.
I swallow. Do you know how many
put
tablets?
in your car?
13 a day.
Really?
And it's driving me potty.
Oh, that's a lot, isn't it? Yeah.
My cat licks me because it's salt and it makes his fur soft.
Oh, really?
He's a Persian.
I think once I go to just having to do the Wednesday one, it's fine.
It'll be all right. Come in. Hi. Hi. Charlotte, is that right? Hi, I'm Dr. Rose.
Nice to meet you.
Hi. This is Laura. She's a healthcare assistant who gives us a hand. So...
Time for the coil.
Be looking forward to it.
Dreading it. Yeah. I know it hurts.
Because you've had it done before, haven't you?
Yeah.
You're keen to do the same thing again.
Yeah, although it hurts for the first
I found for 2 weeks afterwards. Then for 5 years it's absolutely fine. So it seems like the best option of a lot of them.
So this is the coil that we're fitting. So this is what it sort of looks like. Basically what we do is I'll use a speculum, which is the thing that opens up your vagina so we can see your cervix. And then what I'll do is I'll remove the coil that's there at the moment.
Okay.
We have to go through the things that can go wrong. It's very unusual that anything does, but we just need to explain what can happen. No contraception is 100%. There's a tiny risk of pregnancy. If you were to get pregnant, then the pregnancy is more likely to be in the tubes rather than in the womb.
Someone told me their friend was born with their friend's baby was born with a coil on their head.
Yeah, it does happen.
I've heard of something.
The worst thing that can happen to me as a doctor during a coil procedure is if somebody faints. This isn't uncommon because when we're fitting the coil, we stimulate a nerve, which makes it more likely for patients to faint. Because we can't see into the womb, there's a small risk of passing the coil through the wall of the womb. Sorry, I know this is the worst thing to tell people, isn't it? Just before we're doing it, but we sort of have to explain what the possibility. This is never
done that before?
Never, never. So does that all make sense?
Yeah.
Yeah. You happy to sign your?
I am. My womb away.
Your womb away.
It's okay. Hello. Register baby?
Yeah, we just called. He should see a doctor. He's sick.
I've got it. All right. Go up to the 3rd floor if you want.
Nice to meet you. Ali's house. Come on through. Grab a seat. Grab a seat. Right. How can I help?
Misha is now 11 days and totally healthy from day one, gained weight from day one on.
Great.
So, but this afternoon he started coughing and getting a bit weaker than he was usually.
Okay. How old is he? So he's 11 days old?
Yeah.
Okay. And is he breastfeeding or bottle feeding? And that's gone well?
Yes,
Feeding okay?
yes. He never lost any weight even in the beginning.
And nappies, how are they?
He shits maybe 10 times a day, but he's gaining weight and he's healthy.
But the cough is what concerns you?
Yeah, and usually he's just totally boisterous and strong. And now
quiet.
he's like,
Should we have a look? Is that okay? Can you unpop him?
yes.
And just roll just up. Now, can I come this side and you stay at the head ends? That'd be perfect. Okay.
We thought he has a slight temperature, nothing big, but...
Okay. Let me have a listen before he starts crying. This is not... Okay, buddy, let's have a listen. Oh. I know, I'm sorry. It's all cold and horrid, isn't he?
This mucus is like something related to a cold? Or?
Bear with me 1 second, let me just have a good listen.
You all right?
Yeah. Come on, ladies, I can do this.
You'll be fine.
Come on, Mr. Coyle.
You all right?
Yeah, sorry.
It's all right, no. It would be funny if you weren't.
Yeah, I know.
So this is the speculum going in,
Yeah.
okay?
It's like a smear test, this bit, isn't it?
Yes, yeah. So it just feels a bit cold.
Yeah.
You're doing really well.
Okay.
Sorry, do you mind if I hold you?
No, of course you can.
Are you all right?
Yeah.
You'll be fine.
You okay?
Yeah.
So we're going to take the coil out, okay?
So a nice big cough for me.
Cough. There
Okay.
we go.
Is it out?
Yeah,
Yep.
that's out. You all right?
Hurts quite a lot, sorry.
Okay. Is it easing off? It's not what it was like when you got that sharp.
It's still quite sharp, but it's not as bad. It's kind of coming in a wave now.
Yeah.
It's still there. Is that normal?
Yeah.
Yep.
So this is the coil going in now, okay?
You all right?
Is it in?
Yep.
You've done really well. So you're.
I know I haven't.
You have. You've done amazingly.
I was practically crying. I think that's amazing.
I think it was the thought of it.
Hooray, 5 years.
Yeah.
You don't have to worry about it. Just
Thank
sit
you for
there
holding
for a
my hand.
moment. That's all right. That's what I'm here for.
Do you feel all right?
Yeah.
The whole going into the knife sort of thing.
Yeah.
I couldn't.
Like
do it.
people who want cosmetic surgery, like who are willing to put themselves like.
Yeah, just needle me, just chop me open. I don't care. There's no point. It's like my boobs are good as they are.
It's exciting.
So he's a bit congested as well, isn't he?
Yeah.
When he's just breathing like this.
That has been for now 1.5 days.
Has it? Okay.
2 days, something.
Okay, young man. Let's get you up. Are you okay to give him cuddle him over your shoulder?
Yeah, of course.
And I'll just have a listen to his back as well while he's nice and settled. Just nice and settled. Just have a listen.
Haven't lost all your strength.
Is Mum at home?
Yeah.
Okay. Just pop him down for a second again. Oh, no. Oh, okay. Why don't you pop his things back on and then we'll have a chat. He certainly sounds congested when you do listen to him. But actually, when you listen to his lungs, his lungs sound clear.
Good.
So there's no sign at the moment of any infection on his lungs, and his heart rate is not much higher than it should be for his age. So I think sometimes when you have a lot of mucus at this age, because everything isn't as developed, it's difficult to clear it. I think some of the things that might help with that is that, so generally steamy environments, I think would be useful. Some moisture in the air.
We have a thing like that. We put it
around in the bedroom. Perfect. That will be useful. And you can get. I mean, there's very little at the moment for. Saline sprays, but you can get sprays for the nose that helps from the pharmacy that helps clear some of when it's very sticky.
They have that down here?
Yeah, downstairs we'll have that. So let's try the humidity. Let's see how this settles in the next few days. You need to keep a close eye because of his age. They can suddenly change, as you know. So if you find that actually you're struggling with feeding, the nappies are not as wet as they were.
Yeah.
Or he's still not as alert, or things are not improving. Or if you look at his chest and you see that his ribs, he's pulling in his ribs, or at the base of the throat, he's pulling it in when he's breathing, that's a sign that he's working too hard with his breathing. And that's a sign that you should get somebody to see him, even if it's in the middle of the night.
Thank you very much.
Not at all. You're right to get him seen, yeah.
Thank you so much.
No problem, he's nice and alert now. Okay. All right,
Bye-bye.
Take care now. Bye-bye.
He's had a viral infection. He was never that ill, but it tickled up his airways.
Hello. Who's this? Oh, hello.
Are you ready? Oh, good girl.
So you noticed those spots first yesterday as it came on today?
Yeah, and they seem brighter.
Sometimes with skin rashes, it could be due to an allergy. Has anything changed at home? Any pets? No. Or any... Can't smell it yet. Can't smell it yet.
Meningitis is basically bleeding under the skin. So when you wipe a finger over it or put a glass on it, it doesn't disappear. Don't worry about any of that, okay?
Hi, how you doing? You alright?
I'm seeing I'm alright. I'm
Sorry.
not. I feel terrible. I've got a deaf in one ear for start.
Okay.
Which I don't know why. I'm getting a noise there all the time, and I can't hear a damn thing. It's driving me bonkers.
One thing that I was quite keen to do, remember last time you had that cyst?
Oh yeah, I've got
Just
that.
wanted to have a wee look at that if that's
Well, the antibiotics seem to have worked, and it's got like a crust on now.
Yeah, I think we'll have to see what becomes of that, really. That infection has settled down and that there's no real mole there anymore or anything.
If it was a mole, I must have caught it or something like that.
Well, should we just see how it goes? We'll keep an eye.
I'll keep it. Well, I mean,
keep an eye. We're going to be meeting anyway, aren't we?
Okay.
So we can just periodically review it. Okay.
Yeah, sure.
What else would you like to talk about today? Obviously, there's a lot going on, but
I would like to get a consultation with a drink specialist to get me off the booze because I am seriously concerned.
Yeah.
Because I'm getting home now. I'm depressed.
Yeah.
I'm not suicidal. Don't get me wrong, but I just start drinking, and I can't actually just say I'll have 2 and stop.
Yeah.
Once I've had 2, that's it. Boom. I don't know what the answer is. I really don't. I know it's not doing me heart any good at all.
Yeah. It generally doesn't do you good to drink lots and lots.
Especially, I mean, I do appreciate it, but I've got no willpower. I try and try and try. It's very, very hard,
Yeah.
But I do want to stop drinking. I just detest it enormously.
Yeah. Dropped a line to that alcohol liaison.
You haven't heard from them yet?
I was hoping you might have heard from them.
Not a sausage, nothing. I'm being honest, I cannot stop. It's as simple as that.
Yeah. Okay. Alcohol services, I'm going to write to them.
Okay.
Do you want me to give you their number as well so that you can
You could do, if you wouldn't mind. Yeah.
So I'll find that for you in a sec. Okay.
Okay.
Do you want to catch up with me, in a couple of weeks?
Should I make an appointment or should I just give you a ring?
Talk on the phone if you want next time, save you a trip down.
Okay.
Yeah, and then we can see if there's anything that you feel you need to go see and I can stick you in for an appointment.
Fine.
All right.
Thanks very much.
No worries. Take care, all right.
I'll see what I can do.
Yeah, all right. Look after yourself. All right. Cheers. I referred him to drug and alcohol services quite some time ago now, and he was transferred to your team because he fell out of area, full stop. He's really desperate to cut down his drinking, and I would appreciate any support you could provide as soon as possible, full stop. Thank you for taking the time to see him, full stop.
Three people queuing and just me, Carol, and you picking up. Good afternoon.
It's okay, it's one each.
Putney Mead, how can I help?
Putney Mead, good morning, Nicola speaking.
Susan Watts, please. Thank you. Come through. So, welcome. I haven't met you before and think you were booked in to have a health check. Is that right?
Yes. Can I just give you the history? Then it sort of makes sense of it.
Yeah.
I use my stress by using adrenaline. So I'm on overdrive the whole time. And my father shook, and when I do that, I don't shake.
Yeah.
But to eat a bowl of soup, it's impossible. And last weekend, could I stop my shakes so the worst they'd ever be? So I think it's a hereditary pattern.
Yes, it can
rather
be.
than it being dementia or anything. And
Yeah.
I think I'm just so stressed I can't walk in a straight line. Signing my name now, you would have thought it was a spider on the website.
Okay.
So probably because I don't want to go down the Parkinson's line, dementia line, I now put in a program of exercising myself and walking much better. And I can't say in 3 weeks it's made much difference. Makes sense?
It does make sense. It does make sense. But it's an unusual presentation, and
Really?
yeah. What are your concerns that you think these symptoms might be?
I am concerned in case I'm pretending it's not Parkinson's, but then I read the paper today saying everybody's encouraged to go to their doctors and doctors get £50 rent. Oh, God, I've got... Yeah, it's in the Times.
£55.
So I'm very conscious. I put myself in a category that really I might not need to be there. I just need to relax.
Well, I think you've done the right thing, so you're not just living with it. Susan's a psychologist herself and is very aware of anxiety and stress, and she very much, I felt, wanted me to diagnose that was the cause of the tremor. I just felt I couldn't minimise the symptoms as she wished me to. Okay, so let's do some coordination test. It's one of the ones that we ask patients to do is just put your hands straight out in front of you. So
I'm very good at that.
Yeah. And now open your fingers. Yeah, close a bit.
I mentioned that
How do I get back to mine?
the car was stuck in.
I'll get on to tomorrow.
In MS, and he said, yeah, there was one yesterday as well.
And then you do that with sync.
He's in 9, he's in a different room now.
Oh, is he? No, we were in 9 yesterday.
We weren't in 12, wasn't yesterday.
Nice to see you. Come on in.
Likewise. Do you live anywhere near Kingston?
Do I live anywhere near Kingston? No. Why is that?
Oh, in 2 days, 2 people have jumped off the roof of M&S. In 2 different
right?
parts of the store, and our car is trapped there now until tomorrow.
Because you couldn't leave because someone.
Because they jumped off the car park.
Is that
today.
right?
Yes.
Gosh, that's very sad, isn't it? How are you doing?
I'm fine. I'm fine. The blood part of the urine disappeared after 1 tablet.
Did it?
Yes.
Okay.
I still took all 6.
Great. So no more bleeding in the urine?
No.
Any more clots?
No.
Nothing like that?
No.
You were going to see the urologist,
Yes.
is that right? Have
So
you seen the urologist?
Yes, so did you want to see us today to report
how things
to you
gone?
how it all went? Certainly. They reckon they'll get something to you within 48 hours.
Okay.
But hot off the press, you can have it from us.
What did they say today?
I've got stage 1
Okay.
bladder cancer of an aggressive type. When they biopsied all the crap they'd taken out, they found that the cells were would have been of an aggressive nature.
Right.
No evidence of it in the muscle wall.
Great.
And that's it, really. I'm very lucky, primarily because of you insisting on these constant samples and then taking it that bit further.
When you do pick up a cancer, it's very rewarding because it can have a big impact. It has a huge impact on people's lives, and most bladder cancers, thankfully, are picked up very early, before they've had a chance to spread into the lining of the bladder. And therefore, the prognosis for most bladder cancers, thankfully, is very good.
And how are you feeling about all of this? I mean, it's all kind of new stuff, isn't it?
Wonderful. It's whatever it takes.
Whatever it takes, yeah.
Whatever, and I don't feel at all bad. I feel absolutely wonderful that I've got it, because I know I've got it.
In fact, you know you can do something about it.
Yeah, right.
And nothing else is involved. And I
No.
think that's the important
She
bit.
did mention the surgeon, who's a lovely lady, that bladder cancer rarely extends beyond the bladder.
This gentleman is an incredibly positive and determined gentleman. But in a consultation, I think I'm doing 2 things in my mind. One being present in the room and listening to what's being said, but also being curious about what I'm not hearing from someone who's dealing with cancer, and why I might not be hearing that. And that's as important for me.
Okay, good. So you're feeling positive about it?
I don't think I've ever felt particularly negative.
No. Great.
You've not noticed, have you?
No.
Have you?
Well, a couple of times you've been a bit wobbly.
Well, when I made a reservation at Dignitas, I suppose you could call that slightly negative. But they said they didn't have any vacancies that Tuesday.
Will you do it when you stand in front of me? Put your fingers out, extend your arms and open your fingers a bit. And now could you close your eyes? Okay, I'm going to push the hands down and I want you to bring them back to the place that they're at. Now this time I want you to move between your nose and the tip of my finger as quick as you can. Good. Oh. Good. I want you to try and do that as quickly as you can. Quick, 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 quick. And the other side. That one's harder.
Much harder.
Yeah. Now try to do the walking and the balance, okay? So one of the simple ones is just toe heel, okay? Well done, good effort. Okay, so if you could just write that underneath, that would be great, thank you.
Far slower than I used to write.
Really, yeah, yeah. And this arm was tremoring as well.
Oh, was it?
It was when your hand.
Can you tell more than that than the other things you've been looking at?
I think that did give me an indication of probably how difficult it is, being such a capable lady, to then have to work so hard at doing something like that. I was also slightly concerned about your toe walking.
Yeah.
That would make you quite at risk of falling as well as you get older. And it's fantastic that you're doing exercise, and we should really continue because that's going to help your balance. But
right.
You would be more vulnerable for falling as you got older.
I'm very conscious of walking now. I'm trying to keep a straight line.
Yeah. I think I should refer you to see a neurologist.
Right.
I can't diagnose anything just straight off.
Okay, neurologist here I come.
Neurologist, here you go. I'm so glad you've come.
Lovely.
Thank you.
I know, thank you.
You've been so candid.
I don't know how
and
you
open.
manage it, to give this amount of energy out to each patient. Just don't know how you do it.
Well,
I hope tomorrow's a rest day.
it makes it a more enjoyable job.
For some reason, I'm covered in a burning rash.
Right, well, you're a little bit of a mystery.
I have a hot shower and it goes away.
It's weird, isn't it?
You lost 2.5 kilos in 4 days.
Yeah, that's a mystery.
I keep getting these blood blisters.
I mean, these are puzzling, I must say.
Sometimes in medicine we can't say what specifically something is, but I can tell you what it isn't.
What can I do for you?
I have a mobility issue in my right hand.
Okay.
I'm an office worker. Typing is becoming incredibly difficult, really quite painful. It's kind of something which has evolved over the last 6 months. Keeping it really simple, left hand.
Yeah.
That's it fine. Right hand is just have very limited mobility in it.
Okay. And what's the origin of that?
I don't know.
Okay.
I'm typically male, typically late about coming to doctors, all of those things.
Are you left or right-handed?
Left-handed for writing, but like right-handed for sport.
Okay.
The thing I'm wondering is I've learned golf this year. Don't know.
You have enough dexterity to do that, so to grip the club, but
I just noticed pain
typing.
Occasionally.
Do buttons up and stuff?
Doing my cuff is a lot harder.
Yeah.
But I can do it.
Have you noticed it with anything else? Tying your shoelaces?
No, shoelaces is fine.
Would you mind just tying your shoelaces for me? Or untying
It
them?
won't be a problem at all.
I'm just looking at you using that right hand, because that command, you know, from your brain seemed to be automatic and seemed to work fine, didn't it? Do this again, so like you're playing a piano. Do you play the piano by any chance?
I used to a little bit when I was younger, but the left hand's 100%.
Yeah.
I could do that all day long.
And you can't do that at all with that hand?
I'm sure I'm commanding my hand. It's very tiring. I'm going, come on hand, come on hand. It's mentally exhausting even just to do that.
Yeah.
I'm really saying, come on.
Yeah. So, for example, do this. So the elbow, shoulder, you can swing around.
I mean, I've got 2 kids. I can load up.
So
weight.
it's just the fingers, literally.
It feels
what
the
about,
fingers and the wrist.
So do your wrists for me. And round and round. Round with that one.
I'm trying.
So wrist and hand. If I touch your hands, does that feel the same?
Doesn't feel any. Without being extreme, doesn't feel like I've had a stroke or paralysis, anything like that at all.
And so the sensation to you feels the same. You're not noted, no pins and needles, nothing like that.
No, never at all. I would have come. Absolutely would have come.
And just you can't.
I can command it, but I just can't translate it.
I think it's quite common in general practice for a patient to come and to have something that it's very hard to put a name on and to diagnose as something. I think whilst medicine is partly scientific, there's also a lot of art to it as well, if you like, and it's some of what we do is almost trial and error.
What I am going to do is ask for advice. We've got a kind of email advice line. What we need to do is get some sort of imaging or study on that. We can do a nerve conduction, and I just want to check if that's the right thing to do or if it's some other sort of test. So what I'll do is I'll get some advice and then I'll let you know. So I basically I don't want to send you down the wrong route.
Yeah, no, it's a tough one.
But you've absolutely done right in coming to see us, and we need to look into it and find out what's going on.
Patients seem to appreciate it if you admit to your, lack of supreme knowledge almost and say, I actually don't know what's going on here. We're human at the end of the day and we don't know everything, and as long as we're honest about that and admit that, I think they, on the whole, don't seem to have a problem with it, and I don't either, really, I don't think.
I shall get back to you in either tomorrow or Monday.
Cool.
Is that all right?
That's lovely. Really appreciate your time.
Okay.
Thank you very much.
No,
Take
good
care.
to see you. All right. Bye.
Sorry,
Yeah, I was about to say. It's a good, strong handshake, so. All right. Bye.
I've got 40 tasks.
40. I've got none.
All right, rub it in, why don't you?
40 tasks. I haven't. I've got none from today.
I've got one. Just one. It's because I don't delete them. That's how bad I am.
I actually
need help and help.
Come in for
Come in.
Good afternoon.
Hello, hi. Is that Alexander? Is that right?
Yeah. Basically, about a week ago or so, completely out of the blue, in the middle of the night, I woke up to a really bad chest pain, right down the centre bone.
Right.
Nothing else really associated with it. No difficulty breathing. Nothing that was going to cause me concern or think I should rush into hospital. So I put some deep heat on it, and then since then the pain's just been fluctuating. I get a heartburny kind of sensation as well quite a lot of the time.
Is that before the pain came on?
During the pain,
During the
actually,
pain,
to be honest.
okay.
And so it comes in waves, and today and yesterday it's kind of become a little bit more consistent or continuous, I should say.
Right.
Because
sure.
it's making me feel a little bit groggy as well, to be honest.
Yeah. And what had you been doing that day or the day before?
Well,
Can you remember?
I've been going to the gym, and I have been going to the gym probably with more intensity or regularity than I would normally in the last couple of months. I've certainly stepped it up a bit.
Have you been feeling short of breath at any point at all?
It's not so much a shortness of breath as it feels like quite a laboured breathing.
Would it be okay if I had a look?
Yeah,
That's
absolutely,
okay.
of course it is, yeah.
And what do you do work-wise, if you don't mind me asking?
I'm an airline pilot.
An airline pilot?
Yes.
Oh, okay. And have you been on any long-haul flights or anything like that?
Yeah, I mean, I've been flying fair distances, but nothing outrageously far.
So in the last week, or?
Oh yeah, I've been flying.
Oh, okay.
I've been flying most of the week in fairness.
Is it affecting work?
It's not affecting my work. It's just one of those things that it fluctuates, but it never affects my levels of concentration and what.
Fair enough. It's just the kind of niggly thing that's there and comes on and
goes,
lingers a bit. So if I push on it,
Yeah.
can you just tell me if it hurts you at all?
Yeah, that's tender.
That's tender. That caught you. Sorry, I don't mean
It's all
to
right,
make you
that's
jump a bit. What about on the other
actual
side?
Chest itself, no,
Yeah,
it's not
chest
too
wall
bad.
itself.
It's not too bad there.
I'll let you put your
Yeah,
shirt on.
cool.
Do you mind just putting your t-shirt on, not the jumper? Just going to do your blood pressure, and then I'll go through what I think is going on. Hopefully, it'll make a bit more sense.
Yeah, it's fine. I'll try and relax the arm.
Yeah, absolutely. Relax as much as you can. Okay. The upper value's ever so slightly on the high side. Okay. It might be because I've been pushing on your chest and caused you a bit of pain.
Yeah, maybe.
just
I don't
now.
know.
Doesn't strike me as a heart problem in any way, because heart problems tends to feel a bit different, more of a kind of tightness, pressure sensation that's
it's
worse when you're
certainly
doing
not that.
things. And I think you've got an inflammation of the bone here.
Okay.
But the fact that when you push on it, it's quite tender. It suggests that it's something quite local around that area.
Okay.
I think this is almost certainly because of the gym work. The treatment for it is anti-inflammatory medications. So I don't know if you're okay.
Ibuprofens, maybe?
Yeah, exactly. Ibuprofen, okay.
No, thank you for your help.
And I think flying's okay.
Good. If you think it's okay.
No, I think it's okay.
Funnily
In
enough,
case there was
I've
any
got
doubt.
days off now, actually,
Fair
so I'm not in for a while. So I'll give it a rest now for a few days, and fingers crossed it'll work.
Hi there.
Is Dr. King on the third floor?
Yes, he is. He's on the third floor.
I was just about to get there. Is your name Brian?
Yeah.
Yeah, I'll sign you in.
Hi.
Morning.
Is it Margaret?
Margaret Yekutiel.
Yekutiel, yeah. I'm Dr. Bavadia. Nice to meet you. Oh, is that just your...
Listen, I think I've got scabies. I get these frightful attacks of scratching. I mean, it began here and I managed to stop.
Yeah.
I get them on my hands. This was last week, there's the signs.
Right.
I'm also a doctor, epidemiologist, and it just looks to me like scabies. And I bought some stuff, actually, and then somebody told me there's a better stuff called ivermectin, which you can take as a pill. Can I show you it placed on my...
Yeah, please do, please do.
Okay. I just want to show you where... Sorry.
Yeah, of course.
This was one about 3 or 4 days ago.
Yeah,
I scratched. I just couldn't think of anything else it could be. I've had it here.
Right.
There's not much old.
Is there anything else to see?
No.
No, okay. You've had an itchy rash that comes and goes.
Yes.
I've got no information on you. Are you normally fit and well?
Well, I've got cancer of the lung.
Right.
That's been done by stereotopic body radiation, SBRT, about half a year ago. And I had a myocardial infarction 7 years ago.
Okay.
My blood pressure's low, not high. Otherwise, I'm well.
Do you take any regular medication?
I've got some arthritis in my hip, so I take diacerin or something.
Doctors sometimes can be incredibly resilient and feel that because they have some, a lot of medical knowledge and experience, that they just deal with their symptoms. They might try and soldier on.
Where are you normally registered?
Israel.
Okay.
I'm here visiting my sister.
Okay, and you're an epidemiologist? What, like a doctor, like a public health?
Yes.
Okay, all right. And how are things in Israel, all right?
Ghastly. I may have picked it up in Israel. God knows, after this war, all the soldiers coming back. But I don't know. I mean, I didn't have anything there.
A difficult one. It doesn't look like classical scabies, but as you know, scabies is the thing that mimics many forms. I haven't heard of the tablet that you mentioned.
Well, I'll tell you how to spell it.
Ivermectin is not recommended.
Really?
Yeah.
Has it got contraindications?
It's on a named person basis only available and has been used in combination with topical treatments. So I think perhaps you're better just using the permethrin.
Which is the antihistamine one?
Cetirizine.
Cetirizine.
All right.
The tablets.
Yeah.
That's for the whole body. You don't have an ointment instead. I mean, I don't need to take something when I've just got an itch on my hand.
It'd be better with that, probably.
Yeah?
Yeah.
I have in the past treated doctors who have felt that we should be doing one thing for them, and I felt that we should be going down another line.
It's like taking things. More, I mean, I have to, but...
Yeah, try it. It's tolerated pretty well by people.
Okay.
All right, take care. Bye now.
Why do doctors go to the doctor?
That's true. If you're a doctor and your friends are doctors, they could just prescribe anything for you.
Give you drugs.
Yeah.
Sorry, it's not ideal for you, is it? What can we do for you?
I'm going to see my family in South Africa next week.
Okay.
Which is quite traumatic as it is.
Yeah.
But I'm going to run out of pregabalin whilst I'm there, and I just wondered whether I could get some more pregabalin.
Is pain a significant problem then? Have we been sort of playing with things to try and get it manageable, or is it manageable at the moment?
It's not manageable because it's there all the time. So I guess we're having a sort of intensive period of trying to get this tilt assessed more. Yeah. And then also try to take me off some of my morphine because I'm quite heavily addicted to it.
Yeah. Okay. Perhaps not the time to start changing things now anyway, but I wonder have you flown before taking these medications with you?
Yeah.
Sometimes people like a letter for those sorts of medications, which I'd be happy to, but you've never run into problems.
Yeah, I've got a prescription.
Yeah.
Thank you very much.
Anything else we can do for you?
Thank you.
Okay. Again, free. Cheerio.
How are you doing?
Yeah, the tablets are a lot better now. Thank God.
Are they?
Really, really well, yeah.
Mummy, come in.
And I'm actually waking up in the mornings feeling like I've had a sleep.
Great.
I'm so happy with it. I'm so happy, yeah, I feel a lot better.
When are you going?
I'm going to Ireland in 3 weeks, and then we're going the week after. So, yeah.
And where are you going to be staying?
My sister's.
No, in New York.
Oh, New York. Oh, sorry. We're actually staying in a hotel just off Central Park.
It's a beautiful time as well.
It's lovely. I love it. Yeah. I love it. Yeah. And it's not. I don't like going away.
Do you feel frightened to go
I'm a little bit nervous because I am worrying, is something going to happen to tumour up in the air,
There is a risk flying. It's different for every patient and at every stage of the illness, and actually for where in the brain the tumour is. It's to do with the pressure of the oxygen in the cabin.
Thing about it is, I could be here, I could be walking down the road and something had happened, so it's one of them things, you know what I mean?
Before you go, I think I'd quite like to give you a letter as well to take with you, give a medical history, just in case.
Please, God, but if anything happens.
Yeah, I think what was going through my mind through the consultation was I can't make Fidelma better. But I think it was just so important a trip for her to make. It was very symbolic. She'd been given this as a 50th birthday present at the beginning of the year when she was totally ignorant that there was a brain tumour growing. Oh, I'm so pleased you're going.
Yeah, no,
I'm
really
so pleased.
No, they've all been given out to me, my mum. She's
Of course they would.
Go.
Of course they would.
Do you want to give Dr. Ham a high five?
Wow, that's stinging.
Come here, you've been
You
so...
have a good time?
You've been so good to me, so you have. Really, really good.
Have a good time.
Yeah, I will. And you,
Have a good time.
I'll see you. And if
Yep.
there's anything you want, let me know.
Yep.
I did tell you that.
You did tell me that. You did tell me that. Right, lovely to see you. Thank you. All right, bye. Bye. Oh, she's a nice lady.